7 monitors flatlined at the same moment. The ER lights died, and the man holding the clipboard smiled. "Give them all to her," Director Mitchell Greer said, pointing across the chaos at the one nurse nobody ever noticed. "Let's see what she's made of." Nurse Dana Wren didn't flinch, didn't argue. She looked at the row of crashing patients, at the doctors frozen in the strobing emergency lights, at the storm hammering the windows hard enough to crack them. Then she pulled on her gloves, and everything those people thought they knew about her became the most dangerous mistake of their lives. If this story already has your heart pounding, follow my channel, hit like, and drop your city in the comments below. I want to see how far this story has traveled. Now let's begin. The storm came in fast. That was the thing about Colorado weather in late October. It didn't build, didn't warn, didn't give anyone time to prepare. 1 hour the sky was the kind of bruised purple that looked almost beautiful over the Rockies. And the next it was full dark, full fury, sleet cracking against glass and wind ripping through the valley hard enough to knock semis sideways on the interstate. Callaway Ridge Regional Medical Center sat on the eastern edge of the city of Harlan, a mid-size hospital that served a sprawling stretch of mountain communities and highway corridors. It wasn't prestigious, wasn't a teaching hospital, wasn't the place surgeons with ambitions chose to land, but it was the closest trauma center to a 40-mile stretch of I-74, and on a bad night, that meant everything. Tonight was a bad night. Dana Wren was 40 minutes into a double shift when the first call came in. She was restocking supply carts in the East Corridor, moving the way she always moved, quietly, efficiently, without drawing attention, when the radio on the charge nurse's desk crackled to life. "Callaway Ridge, this is EMS Unit 9. We have a multi-vehicle collision, Highway 174 westbound near mile marker 62. Preliminary count is 11 victims. Repeat, 11. First units are 4 minutes out. You need to be ready." The charge nurse, a heavy-set man named Roy Patton, who had been doing this job for 16 years, picked up the radio with hands that were already steadying themselves. "Copy that. What's the breakdown?" 2 critical, 3 serious, 6 walking wounded at minimum. We've got a jackknife tanker, 4 passenger vehicles, and a school bus. "Dana, there may be kids." Roy set the radio down and turned. The hallway had already shifted. 3 nurses moved toward the trauma bays. A resident appeared from the elevator looking half awake. A PA, named Lena Holt, started running through the mental checklist she always ran when things were about to get bad. Dana had already moved. She didn't announce it. She didn't ask for assignments. She walked to the supply closet at the end of the corridor and began pulling trauma kits, stacking them with practiced efficiency, counting out IV lines, pressure bandages, airway kits. Her hands knew this choreography better than she could explain it. They'd done it in worse conditions than this. Much worse. "Wren!" The voice came from the other end of the hallway, and the tone of it made several nurses glance up. Director Mitchell Greer was 53, silver-haired, and built for the administrative world in a way that made him look slightly wrong, standing in an actual clinical space. Too clean, too composed, his tie too tight for a building where people bled. He'd been running Callaway Ridge for 3 years, and had spent most of that time reminding staff of exactly how he'd gotten there. He wasn't a doctor. He'd never been one. He'd come up through hospital administration at a chain of regional facilities in the Midwest, and he had the specific confidence of someone who had spent decades making decisions about medicine without ever being accountable to a patient. "Wren," he said again, walking toward her with the unhurried stride of a man who expected space to clear in front of him. "What are you doing?" She didn't stop moving. "Prepping for incoming. EMS called 11 victims from a highway collision. I can hear the radio." He stopped beside her, looked at the pile of supplies she'd pulled, and his expression shifted into something that wasn't quite a frown, but was close enough. "You're pulling from the East Bay stock. Those are Dr. Harmon's designated reserves. Dr. Harmon is in surgery upstairs." "That's not the point." Dana paused. She set down the package of IV lines she'd been holding and looked at him directly. She had a face that people consistently misread, wide-set brown eyes, a calm that people took for passivity, a mouth that rarely rushed into speech. She was 38 years old and had learned a long time ago that most confrontations didn't need escalating. They needed managing. "Director Greer," she said, "we have 11 trauma patients incoming, 2 of them critical, and the storm is already affecting our response times. I can sort out the supply attribution paperwork after we've stabilized. You'll sort it out now." he said, "or you'll use the designated trauma stock from Bay 1 like everyone else." A few nurses nearby had gone very still in the way that people go still when they're pretending to be busy. Dana looked at him for a moment, then she picked up the supplies, restacked them onto the cart, and pushed it toward Bay 1 without another word. Greer watched her go. He said something to the charge nurse, something about documentation, about protocol, but Roy was already moving toward the entrance because the first ambulance had pulled under the portico and the back doors were opening. The next 20 minutes were controlled chaos, which was the best version of chaos you could ask for in an ER. The first two ambulances brought the critical patients. A man in his 50s named Gerald, construction worker, chest trauma, flail segment on the left side, oxygen sat dropping, and a teenage girl, 16, maybe 17, who had been in the front passenger seat of a sedan that took a direct side impact. She had a Glasgow score of 11 and a scalp laceration that was bleeding in a way that suggested something more serious underneath. Dr. Frank Okafor took Gerald. He was the senior ER physician on tonight, a compact Nigerian-American man in his early 50s who was excellent under pressure and rarely said more than he needed to. His resident, a second-year named Josh Beal, fell in beside him automatically. The girl, later identified as Marissa Taft, 17, went to Bay 2. The attending assigned was Dr. Priya Mehta, a hospitalist pulled down from the medical floor because the ER was already short-staffed. Dana got Bay 3. Bay 3 was a woman named Ruth Ann, 61 years old, a grandmother who had been driving her sedan home from a birthday dinner when the tanker jackknifed 3 cars ahead of her. She had mid-sternal chest pain, an irregular pulse Dana clocked immediately, and the particular gray color around her mouth that said this wasn't just shock. "Ruth Ann," Dana said, pulling up beside her as the paramedics transferred her across. "Can you hear me?" "I can hear you just fine." The woman's voice was thin but sharp. "Is my granddaughter with me?" "She was in the car. We're going to find out. Right now I need you to focus on me." Dana got the leads on in under 40 seconds, pulled the rhythm strip, and looked at it with the expression of someone reading a document they'd read 100 times before. The paramedic beside her, young kid, maybe 25, still wearing the adrenaline of the scene on his face, leaned in. "We gave her aspirin in the field. She was complaining of chest pain before impact. We think she may have had a cardiac event before the collision." "She did," Dana said. "Get me a crash cart staged outside this bay. Don't bring it in unless I call for it." The paramedic hesitated. "Shouldn't you stage it outside the bay?" she said again, without looking up. "If she sees it, her pressure will spike." He went. Dana pulled the blood pressure cuff, got the reading, didn't show anything on her face. Ruth Ann was watching her with the particular alertness of someone who has been sick before, who knows how to read medical faces. "That bad?" the woman asked. "That manageable," Dana said. "You're going to feel some pressure on your chest. I'm going to listen." She had the stethoscope on before she finished the sentence, and what she heard confirmed what the rhythm strip suggested. She straightened, already reaching for the IV kit. "Ruth Ann, I'm starting a line in your left arm. You're going to feel a pinch. I've had worse. I know you have." The IV went in clean. First try, smaller vein, difficult angle, didn't matter. Dana was already calling the medication order to the nurse behind her, a young woman named Carly, who was competent but visibly rattled, and simultaneously checking the monitor again because the rhythm had shifted in the last 30 seconds. "Carly, I need the cardiologist on call paged now, not the resident, the attending." "Dr. Weston is the attending tonight." "Then page Dr. Weston." From across the ER, through the noise of the other bays, and the continued arrival of ambulances and the storm battering the skylights overhead, she heard Greer's voice. "Wren, who authorized you to page cardiology?" She kept her eyes on Ruth Ann. "The rhythm strip authorized it. This patient is stable. Not yet, she isn't." She looked across at him then, just briefly, over the controlled chaos of the floor. "Director, I need 30 seconds without interruption, and then you can have the floor." He didn't get 30 seconds. He got nothing, because the monitor beside Ruth Ann suddenly spiked. V-TAC, wide complex, the kind of rhythm that doesn't wait for anyone's permission. And Dana had already moved before the alarm finished its first cycle. "Crash cart," she said. The paramedic who had staged it outside the bay, the young one, the hesitant one, pushed it through the door in under 3 seconds. What happened in the next 4 minutes, Carly would describe later to 3 different people in 3 different ways, and every version would sound slightly unbelievable. Dana moved through the code with a fluency that didn't look like training. It looked like memory, like her hands had done this so many times in so many conditions that thought had stopped being part of it. She called the sequence: medications, timing, charge levels, without hesitation, without looking things up, without the brief pause that most nurses showed when they hit an unexpected complication. When the first shock didn't convert the rhythm, she didn't freeze. She adjusted. When it converted, 2 minutes and 40 seconds in, Ruth Ann gasped and grabbed the side rail and said, "Did something just happen to me?" "Your heart took a detour," Dana said. "It's back on the right road." That doesn't sound like a medical term. It isn't. She was already checking the post-conversion rhythm. Better. Dr. Weston arrived 4 minutes later, looked at the strip, looked at the notes Dana had already written, and said with the tone of a person who doesn't give compliments easily, "Good call on the page. Thank you. She needs the cath lab." "I've already called ahead." Weston looked at her. A beat passed. Then he went back to the strip without further comment, which was, from Weston, practically a standing ovation. Dana moved Ruth Ann toward transfer, handed her off to the transport team, and had already turned toward the next bay before the woman's cart had fully cleared the door. Ruth Ann called after her. "What's your name? I want to know your name." And Dana gave it over her shoulder, already moving, already gone. The storm escalated at 9:47 p.m. The first power fluctuation hit at 9:50. The lights dimmed, the backup generators kicked in with a mechanical groan that shook the walls slightly, and then everything steadied, but not everything came back. The elevators went to emergency mode, restricted to a single car. The secondary HVAC system for the upper floors cut out entirely. And in the OR on the 3rd floor, 2 surgeons who had been in the middle of a routine appendectomy found themselves working under battery-powered surgical lights while a nurse called down to the ER to warn them that they would not be coming down to help anytime soon. In the ER, Donna heard this and recalibrated. She was standing at the central nursing station when the call came through, and she looked at the board. The current patient census, the incoming ambulance alerts, the staffing breakdown. With the same quiet focus she brought to everything. Roy Patton was beside her, phone at his ear, his jaw tight. "That's the 3rd ambulance still incoming," he said. "We've got a kid, unconscious, multiple fractures, driver of the tanker, possible internal, and a woman who was apparently walking wounded at the scene but went down in the ambulance. What's our current status?" He went through the list. 3 patients in active treatment, 2 stabilized and awaiting disposition, 1 transferred to cath lab. The trauma bay is still running. Greer had pulled 2 nurses upstairs for a situation on the cardiac floor. Apparently, the power fluctuation had triggered a pacemaker malfunction alert, leaving the ER with a skeleton crew. Dana listened to all of it. She didn't interrupt. When he finished, she said, "Okay, I'll take the kid." Okafor has his hands full with the chest trauma in Bay 4. "I'll take the kid." She looked at him directly. "Roy, I'll take the kid." Something in the way she said it made him stop arguing. The boy's name was Marcus. He was 9 years old, and he had been sitting 3 rows back on the school bus that had clipped the jackknife tanker and spun into the guardrail. Most of the kids on that bus had walked away with cuts and bruises, the terrifying near miss that would become a story their parents told for years. Marcus hadn't walked away. He'd been in the window seat on the impact side, and the force had thrown him across the aisle and into the overhead bar. He came in unconscious, GCS of 8, one pupil slightly slower than the other. Dana saw that last detail the moment the paramedics rolled him through the doors. She didn't say anything about it immediately. She got him into the bay, got the primary survey done in under 90 seconds. Airway intact, breathing present but shallow, circulation maintained, significant deformity at the left forearm, contusion across the right temporal region that was swelling as she watched. The paramedics gave their handoff. She listened, asked 2 specific questions, got 2 answers that confirmed what she was already thinking. "I need neurosurgery on the phone," she said to Carly. "Not a page, a phone call. Now." Carly went. The boy's mother had arrived somehow. Dana didn't know how, The details of it were beyond her awareness right now, and was being held in the corridor by an orderly because the hospital policy was no family in the active trauma bay. Dana could hear her from behind the curtain, the specific register of a mother's fear, higher than a scream and more sustained, and she filed it away in the part of her mind that registered things without reacting to them. She was setting up for intubation. The GCS had dropped to 7 in the 3 minutes since arrival, and she wasn't going to wait. When Greer appeared in the bay doorway. "Wren, what is your justification for calling neurosurgery?" She had the laryngoscope in her hand. "Unequal pupils, declining GCS, temporal contusion with progressive swelling. 9-year-old. I need neurosurgery." "That's a diagnostic decision. You're not a physician." "Then get me one." She looked at him over the boy. "Right now. If you have a physician available who can be in this bay in the next 30 seconds, send them. If you don't, step back." His face did something complicated. Behind him, she could see the 2 nurses he'd pulled for the upstairs situation, both of them standing in the corridor watching. "This is insubordination," he said. "This is a kid with a brain bleed." She looked back at Marcus. 30 seconds, Director." He didn't move. She intubated. The tube went in on the first pass, clean placement, confirmation by capnography. She secured it, called the ventilator settings to Carly, and was already assessing the response when the neurosurgeon, Dr. Amara Lindqvist, reached by phone, already heading toward the hospital when the call came through because she lived 6 minutes away, pushed through the ER doors, and made straight for the bay. She was a tall Swedish-American woman in her early 50s who wore her gray streaks without apology and had the particular authority of a surgeon who had stopped tolerating inefficiency sometime in her 40s. She looked at Marcus, looked at the monitor, looked at Dana's notes, which Carly had printed and handed her without being asked. "Who made this call?" Lindqvist said. "I did," Dana said. Lindqvist looked at her for a moment. Dana was at the bedside adjusting the ventilator, not quite meeting anyone's eyes. She had the slightly removed quality of someone running calculations that no one else could see. "Good call," Lindqvist said. She turned to the resident behind her. "Get me CT, now. We're not waiting." She wheeled Marcus out herself. Dana stood in the empty bay for 4 seconds. Then she stripped the gloves, disposed of them, pulled a fresh pair, and walked back to the central station to see what had come in next. Greer was standing near the desk. When she passed him, he said quietly, so that only she could hear it, "We'll talk about your conduct tonight when this shift is over." She didn't break stride. "If everyone's alive when this shift is over, I'll consider it a good conversation. Just go." The third critical patient, the tanker driver, came in at 10:20 and was the hardest. His name was Dale, 52, and he'd been behind the wheel of an 80,000-pound liquid chemical tanker when a blown rear tire caused the jackknife. He'd been thrown forward, restrained by the belt, but the intrusion into the cab had done what belts can't fully prevent. Significant abdominal trauma, signs of internal hemorrhage, and a blood pressure that told a story nobody wanted to read. Dr. Okafor came in from Bay 4 when he saw the numbers. He took one look at Dale and one look at Dana, who had already started 2 large-bore IVs and gotten the initial ultrasound probe on the abdomen. "What are we looking at?" he said. "Positive fast," she said, which meant the ultrasound was showing free fluid, blood, where there shouldn't be any. "He needs the OR." "Lindqvist is with the kid." "Lindqvist is a neurosurgeon. We need a general surgeon." She was already looking at Roy. "Who's our on-call general?" "Dr. Thatch." "Get him." "He's coming from home." "Then we buy time." She looked at Okafor. He was already nodding, pulling gloves, because there was nothing to argue about, and both of them knew it. What followed was the particular grind of keeping someone alive while the clock ran. Fluid resuscitation calibrated carefully, pressure monitoring, the constant adjustment of a situation that wanted to deteriorate and had to be prevented from doing so by attention and intervention, and the refusal to accept the trajectory it was on. Dana and Okafor worked side by side without much conversation. They'd been in the same ER long enough to know each other's rhythms, and tonight those rhythms were efficient and unsentimental. Once, when Dale's pressure dipped below a threshold that required a specific intervention, she called it and had the medication drawn before Okafor had finished his sentence. He glanced at her. She didn't explain. At 10:51, Dr. Thatch pushed through the ER doors, windswept, still in his civilian clothes, coat half off. took the handoff in 45 seconds, and said, "Let's go." They went. Dana watched the gurney move toward the elevator, and then she turned back to the board. The storm was still screaming outside. The power had flickered twice more in the last hour. Somewhere upstairs, Marcus was in CT, and she didn't have the results yet, and that was the thing her mind kept returning to. The slightly slow pupil, the swelling she'd seen building under the skin of his temple, the way his GCS had dropped in those first few minutes. She pulled out her phone and called the CT suite directly. The tech who answered said, "We're just finishing." "Tell Lindqvist to call me the moment she has the read," Dana said. A pause. "Are you his attending?" "I'm the nurse who intubated him. Call me." She hung up. Behind her, from near the administrator's corridor, she heard Greer's voice on the phone with someone, his tone low but clipped, and caught the words liability and undocumented procedure and documentation review. She understood, without needing to hear more, what was being assembled. At 11:14, with the storm at its loudest, the ER receiving entrance slid open against the wind, and two people walked in who were not paramedics, not patients, and not families. They wore civilian clothes, federal credentials. Behind them, moving with the unhurried certainty of someone who had been in this building before and already knew the layout, was a man in military dress uniform, dark blue, decorated, the kind of uniform that gets worn when formality matters. He stopped just inside the entrance, and his eyes moved across the ER floor until they found her. Dana was at the central station, writing in a chart, her back partly toward the door. She felt it before she heard it. The specific change in the quality of a room when someone enters who changes the shape of things. She turned. The military officer was Colonel James Vera, and he had been looking for her for 14 months. His face registered something that wasn't quite surprise, more like the expression of someone who'd been right about something they'd hoped they were wrong about. He said, "Sergeant First Class Dana Wren." The charge nurse dropped his pen. Two nurses at the adjacent station turned simultaneously. Greer, coming out of the corridor with his phone still in his hand, stopped walking. Dana looked at Vera across the ER floor. Her expression didn't break, didn't open, didn't do the thing that an ordinary person's face would do in that moment. She said, "Colonel?" And the ER went so quiet that for one moment, the storm outside was the only sound in the building. The quiet didn't last. It never did in an ER. Something always broke it. A monitor alarm or a radio call or someone's voice cutting through. But this particular quiet was different, and everyone in the room felt the difference. It was the kind of silence that forms around something unresolved, something that's been in motion for a long time and has just arrived at the place it was always heading. Colonel James Vara stood near the entrance with his hands at his sides and his eyes on Dana, and the two federal agents flanking him had the patient stillness of people who were waiting for a specific thing to happen and were prepared to wait as long as it took. Dana looked at him for 2 full seconds. Then her phone buzzed. She looked at the screen, CT suite. She held up one finger toward Vera, not dismissive, not performative, just a fact, and answered. "Wren." The CT tech's voice came through. "Dr. Lindqvist asked me to call you. She said tell you. Epidural hematoma. Right temporal. She's taking him to the OR right now. She said, and I'm quoting, 'Your read was correct. Thank you.'" She hung up. Carly was watching her from 3 feet away. Roy Patton had retrieved his pen but wasn't writing anything. The ER had returned to its functional noise, monitors, movement, the storm, but the attention in the room hadn't shifted. Everyone was doing 2 things at once, their job and watching the corner of the floor where a decorated military officer was waiting for a nurse to finish a phone call. Dana walked toward Vara. She didn't rush, didn't stall. She moved the way she moved through everything, with the economy of someone who had learned a long time ago that unnecessary motion costs time you might not have. She stopped 2 feet from him. "This isn't the place for this conversation." "I know," Vera said, "but I've been standing in a lot of places waiting for this conversation, and I've run out of patience for choosing the right one." One of the federal agents, a woman, 30s, dark blazer, the kind of posture that announces itself without trying, stepped forward slightly. "We're with the Inspector General's office, Department of Defense. We have—" "I know who you're with," Dana said. She looked at Vera. "Tonight isn't the night." We're aware of the situation here. He said it without apology. We monitored the EMS calls. We know what you've been dealing with. Then you know I'm not done. We're not asking you to stop. He glanced toward the bays. We're asking you to talk while you work. We've done it before. That was true. She looked at him for a moment longer, then turned and walked back toward the nursing station without waiting for him to follow. He fell in beside her. The two agents stayed near the entrance, close enough to observe, far enough to not be in the way. Greer materialized from the corridor like a man who had been listening for his cue. Excuse me. His voice had that administrative sharpness that was meant to project authority and usually succeeded. This is a restricted clinical area. Visitors and non-medical personnel need to... Vera looked at him the way soldiers look at things that are not threats, but are in the way. He reached into his breast pocket and produced a folded document. He held it out to Greer without a word. Greer took it, read it. His jaw tightened. It was a federal operational access authorization. Dana didn't see the specific language, but she knew what it meant by the way the color shifted in Greer's face, from the controlled flush of irritation to something paler and less certain. This doesn't explain why... he started. It explains everything it needs to, Vera said. He turned back toward Dana. You were saying... Greer looked at the document again. Then he looked at Dana. There was something new in his expression, not quite recognition, but the thing that precedes it. A recalculation happening somewhere behind his eyes that he hadn't expected to need tonight. He folded the document and held it back out to Vera without another word. Yet, Dana found them a corner near the staff break room doorway, not private but functional. She leaned against the wall with her arms crossed, her badge catching the light, her eyes already tracking the board behind Vera's shoulder because she couldn't fully turn that part of her brain off. 14 months, she said. 14 months, he agreed. You were careful. I wasn't hiding. You weren't exactly broadcasting either. He said it without accusation. Donna. The situation with the 82nd's medical unit. The investigation wrapped 6 weeks ago. 3 officers are facing courts-martial. The testimony we needed, I gave testimony. You gave a written statement from a P.O. box in Denver. He let that sit for a moment. The JAG office needs a live witness. The defense team is challenging the documentary evidence, and without a direct account from someone who was present during the Kessler incident, I was present during 12 incidents, she said flatly. Which one are they challenging? All of them. He watched her face. But specifically March 15th, the field station at... I know which one. Her voice didn't change, but something in the set of her jaw did. Vera, I left because I was done, not because I was running. I know that. Do you? Because sending 2 IG agents to my ER in the middle of a mass casualty event suggests a certain amount of... We didn't know it was going to be a mass casualty event when we drove here. His voice was even, not defensive. We got the call about the highway collision after we were already in the building parking lot. We waited 40 minutes in the car because your charge nurse looked like he was about to stroke out every time the radio went off. She almost said something, didn't. I need you to come in, Vera said. Not tonight. I understand tonight, but this week. The hearing is in 11 days. She looked past him toward the board. Carly was flagging her. The woman who'd collapsed in the ambulance had just been brought in, the one Roy had mentioned earlier, and her BP was reading in a range that required attention. I have to go, Dana said. Dana, I heard you. She pushed off the wall. 11 days, I'll call you tomorrow. She walked away from him. He watched her go, and there was something in his expression that the agents would later describe differently. One of them called it relief, the other called it something she couldn't quite name. Both of them were probably right. The woman from the ambulance was named Petra Halverson, 44, a middle school science teacher who had been standing on the highway shoulder helping a teenager out of a wrecked car when a piece of debris struck her in the back. She'd been ambulatory at the scene, refused transport twice, then lost consciousness in the ambulance on the way. When Dana reached the bay, Petra was awake but disoriented, BP at 88/50 and dropping, pulse thready. The paramedic who'd brought her in was a different one, older, experienced, and his handoff was clipped and clean. She didn't want to come, he said, kept saying she was fine, then she just dropped. Any obvious trauma? Dana had her hands moving already, assessment running in parallel with the conversation. Nothing visible. Possible internal. Could be spinal. She took impact to the mid-back. Dana ran her fingers along Petra's spine with careful deliberateness. The woman hissed. "Right there?" Dana said. "Yeah." Petra's voice was thin. "Is it bad?" "I need a better picture." She looked at Carly. "Get me a portable ultrasound and move the portable x-ray in here. I want lumbar imaging." She started the IV herself. Petra's veins were small and had done what veins do when blood pressure drops, retreated, and got it on the second try, which was honest work, not a failure. She ran fluids to start buying pressure and watched the monitor with the peripheral attention of someone who no longer had to consciously focus on it. The ultrasound came. She ran it herself because the tech was across the floor with another patient. What she found in Petra's retroperitoneal space made her set the probe down with a specific care that Carly, watching, would remember. "I need a surgeon in this bay," Dana said. "Thatch is in the OR. Is there anyone else?" Dr. Osei just came on. He's the overnight general. "Get him." She looked at Petra, who was watching her with the frightened alertness of someone who has correctly understood that the expression on a medical professional's face means something specific. "Petra, you have some internal bleeding that we need to look at more carefully. We're going to get a surgeon in here and figure out exactly what we're dealing with." "I should have let them bring me sooner," Petra said. Her voice had the flat quality of shock beginning to set in. "Yeah," Dana said, because lying to patients wasn't something she did, and Petra seemed like a woman who could handle the truth. "But you're here now. We'll work with what we have." Petra almost laughed. It came out wrong, but it was real. Dr. Osei arrived, a compact Ghanaian-American man in his early 40s who had the quality of someone who'd trained in environments where resources were limited and decisions had to be fast and right the first time. He looked at the ultrasound images Dana had saved, looked at Petra, looked at the monitor. "Retroperitoneal hematoma," he said. "That's what I'm seeing," Dana said. "She needs imaging to grade it. Her pressure is 8.8 and dropping. I don't think she has time for the full CT protocol." He looked at her. A beat. "You think she's active?" "I think she might become active in the next 15 minutes if we don't move." Osei made his decision in 4 seconds. "Prep her for the OR. If it's stable on imaging, we'll manage it. If it's not, I need to be in a position to act." He looked at Carly. "Call the OR coordinator." He turned back to Dana. "You've done this before," he said. It wasn't quite a question. She was already preparing the transfer notes. "Done what?" "This." He gestured vaguely at the bay, the monitor, the IV setup. "The read, the call. This isn't how nurses usually—" He stopped himself. "I don't mean that as an insult." "I know." She handed him the printed notes. "She's yours." He took the notes, looked at her for another moment with the expression of a man revising something. Then he wheeled Petra toward the OR elevator without finishing whatever he'd been thinking. No. By midnight, the incoming surge had slowed to a trickle. The highway had been cleared and rerouted. The remaining walking wounded from the collision had been treated and discharged or admitted. The storm hadn't eased. If anything, it had settled into a sustained roar that vibrated the windows at specific frequencies. But the ER had moved from crisis mode into the steady work of a bad night, rather than a catastrophic one. Roy Patton found Dana in the supply corridor, restocking what she'd used, doing it by habit while her mind was somewhere else. 4 admissions, 2 to the OR, 1 to the cath lab, 1 to neurosurgery, he said. "Every patient you touched is alive." She kept stocking. "That's a good night," he said. "It's the baseline." He was quiet for a moment. He had the look of a man who wanted to say something and was working out whether it would be welcome. He'd known Dana for 2 years, which was long enough to understand that certain conversations required a specific kind of approach. "The federal agents are still here." "I know." "Greer's been on the phone in his office for the last hour. I can hear him from the station." She put a package of IV tubing on the shelf. "How's Carly holding up?" "She's okay. She was shaky earlier, but she steadied." He paused. "She said she's never seen anyone intubate under those conditions and make it look that easy." "It wasn't easy." "No, but you made it look that way, and that matters when the other people in the room are scared." He crossed his arms. "Dana, who are those people?" She turned to face him. Roy was a decent man, had always been a decent man, and he was asking because he'd spent 2 years trusting her in a room where trust was the difference between patients living and dying, and he felt like he deserved to know if the ground had shifted. Department of Defense investigators, she said, and an old CO. CO, he repeated, like commanding officer? Like commanding officer. He absorbed this. How long were you in? Long enough. Dana. 11 years? She looked at him directly. I was a combat medic. Combat rescue. The last 4 years the work was classified. I can't give you much detail. She picked up another package. When I got out, I got my RN. I came here. That's the story. He stood with this for a moment. The corridor hummed around them. The ventilation system, the distant sound of the monitors, the storm outside working itself into the walls. The stuff you did tonight, he said. The intubation, the fast exam, the cardiac code. That's not RN scope. RN scope varies by state. Dana. Colorado has expanded scope provisions in mass casualty conditions. I stayed inside them. She met his eyes. Mostly. He let out a breath that was somewhere between a laugh and a sigh. Okay, he pushed off the wall. Greer's going to make this difficult. He was already making it difficult. More difficult then. He started back toward the station, then stopped. For what it's worth, in 11 years working this floor, he gestured toward the ER generally, toward the night they'd just been through. I've never seen anyone hold it together like that. Just want you to know someone noticed. She watched him go. Then she turned back to the shelf and restocked the rest of it in the particular quiet of someone who has been seen more clearly than they expected and doesn't quite know what to do with it. Greer came for her at 12:40. She was at the central station finishing a chart when he appeared from the direction of his office with 2 sheets of paper in his hand and a stillness about him that was different from his usual controlled energy. He'd changed something in his approach. The bluster from earlier in the night had been replaced by something more deliberate, more careful, and that was, if anything, more concerning. He set the papers on the desk in front of her. I've been on the phone with HR and with the hospital's legal counsel, he said. His voice was quiet, the kind of quiet that's chosen. I've also spoken with the state nursing board's overnight line. He tapped the papers. What you did tonight, specifically the intubation, the ultrasound interpretation, the medication orders you called without physician co-signature, constitutes practice beyond your documented scope. Dana looked at the papers. Didn't pick them up. The intubation was a life-threatening emergency with no physician immediately available, she said. Colorado Statute 25-1.5-103 covers. I've been briefed on the statute. He pulled out a chair and sat, which was unusual enough that it shifted the quality of the confrontation. The issue isn't the statute, the issue is documentation. 3 of the interventions you performed tonight have no co-signature and no physician order documented in the system. That's a compliance problem regardless of the clinical outcome. She looked at him. The clinical outcome is that everyone is alive. The clinical outcome doesn't retroactively authorize undocumented procedures. Then let me document them now. You can document them, but the gap already exists. He straightened the papers with precise movements. I'm placing you on administrative leave effective immediately, pending review. You'll receive the formal notice by email within the hour. He looked up. I need your badge. The station went very quiet. Roy Patton, 3 feet away, had stopped typing. Carly, across the floor, had looked up. The 2 federal agents, Vera's agents, were near the entrance where they'd been for the last 2 hours, and one of them had taken her phone out. Dana looked at Greer for a long moment. She looked at the papers. She looked at her badge, clipped to her scrubs, the Callaway Ridge logo worn at the edges because she'd been wearing it for 2 years. She unclipped it. She set it on the desk between them. The boy, she said, Marcus. He's in neurosurgery. If Lindqvist needs anything from the ER team tonight, she'll need someone who knows the intubation details. Make sure Okafor has my notes. That's no longer your concern. It's my concern until it isn't. She picked up her personal phone. I'll be in the parking lot. She walked away from the desk. She walked past Roy, who looked like he wanted to say something and couldn't find the words fast enough. past Carly, who had gone pale, past the two agents, one of whom, the woman, met her eyes with an expression that was not sympathy exactly, but was adjacent to it. She pushed through the ER doors into the service corridor. Behind her, she heard Vera's voice, low, clipped, the tone she recognized from every briefing he'd ever run where something had gone sideways. He was speaking to one of his agents, and she couldn't make out the words. She walked to the end of the corridor and stopped. The service exit was to her left. Through the small rectangular window in the door, she could see the parking lot, storm-lit, rain sheeting sideways across the amber pools of the lot lights. Her car was out there. She could be in it in 30 seconds. She stood in the corridor for a moment. 11 years. The things those years had contained, the field stations, the night extractions, the patients who made it and the ones who didn't, the specific sound of a medevac helicopter in the dark that meant the difference between everything and nothing. And then the end of it, which had not been clean or simple, which had involved the Kessler incident and what she'd seen and what she'd reported and what had happened after she'd reported it. And then 2 years of this, of building something quieter and more sustainable, of learning to be useful in a different context, of letting herself believe that the life she'd made here was solid. The door at the end of the corridor opened. Vara came through it. He wasn't running, he never ran, but he was moving with the controlled urgency of someone who has made a decision and is acting on it. He can't do that, Vera said. He did it. Dana. He stopped a few feet from her. The federal access authorization I showed him, that isn't just operational clearance. You're a material witness in an active DOD investigation. He doesn't have the authority to. It's a hospital administrative action. You'd need an injunction to. I can get one. He said it simply. It'll take until morning, but I can get one. She looked at him. The corridor was fluorescent bright and utilitarian, the walls that particular shade of off-white that existed only in service areas of institutions, and Vera stood in it in his dress uniform looking faintly incongruous, like something from a different context dropped into this one. I'm not asking you to fight my employment battle, she said. That's not what this is. He held her gaze. You know what I found when I started looking for you? After the testimony gap, after the report started going sideways. He paused. I found 3 separate complaints filed against Callaway Ridge. Anonymous. To the Joint Commission and the State Health Department. Safety concerns. Documentation irregularities. A pattern of patient outcomes that didn't quite match the official record. She didn't say anything. Those complaints went nowhere, he said. Every time the review found insufficient evidence. Every time the hospital's documentation was oddly complete. Every time the staff member who'd raised the concern initially either recanted or left. He watched her face. You filed one of those complaints. That's not something I can confirm or deny. Donna. The storm hit a gust that rattled the service door in its frame. The sound filled the corridor for a moment. 8 months ago, she said finally, a patient died. Post-surgical, transferred out of the ICU too early. The documentation said all vitals were within normal limits at transfer. I was on the floor when they transferred him. His vitals were not within normal limits. She said it flatly, without performance. I filed a concern report internally first. Nothing happened. Then I went to the Joint Commission, and the complaint was reviewed and closed. 6 weeks later. Insufficient evidence. She looked at the wall. The original vital signs documentation had been corrected. Updated in the system after the fact. I couldn't prove when the changes were made. Vera was quiet for a moment. The IG office has been developing a parallel line of inquiry, he said carefully, separate from the JAG case, which is part of why we're here, not just the testimony. She looked at him. What does that mean specifically? It means, he said, that the federal agents with me tonight aren't here only because of what happened in that field station in March. He held her gaze. They're here because Callaway Ridge Regional Medical Center has been flagged, and because you're one of 3 witnesses we need to talk to. He paused. Tonight accelerated the timeline. The corridor's overhead light buzzed for a moment, a flicker, barely noticeable, the storm making itself felt at the infrastructure level. Dana looked down at her hands. No badge. No gloves, just her hands, which knew how to do things that most people spent their entire careers never learning. She thought about Ruth Ann in the cath lab, about Dale in surgery, about Marcus, 9 years old, brain bleed, the slow pupil she'd caught in the first 90 seconds. She thought about the vital signs that someone had gone back and changed. "What kind of timeline?" she said. Vera opened his mouth to answer. His phone buzzed. He looked at it. Something moved across his face. Not alarm, but the particular tension of a man who has just received information that changes the shape of what he was about to say. He held the phone out to her. She read the text from his agent at the entrance desk. Director Greer just attempted to access and delete the overnight ER log files from the hospital server. IT security flagged the attempt. Log shows he used his admin credentials at 12:52 a.m. The files were backed up automatically at 12:45, 7 minutes before he tried to delete them. Dana read it twice. Then she handed the phone back. She turned and walked back toward the ER doors without a word, and Vera had to move quickly to keep up. "Dana, where are you going?" "Back to work," she said. "Someone has to." She pushed through the doors. The ER opened around her. Monitors, light, the controlled noise of the night shift. Roy looked up from the desk. Carly looked up. 3 nurses along the far wall turned at the sound of the doors, and Dana Wren walked back to the central station, picked up the chart she'd left unfinished, and looked at Greer's office. The light still on behind the frosted glass, the shadow of a man moving back and forth inside it, a man who had just tried to erase something and found out too late that it was already saved. She looked at the board. She looked at her hands. Then she looked at the door of Greer's office again, and the expression on her face was the one she'd worn in field stations and forward operating bases, and every room where she'd understood exactly what was at stake. Not blank, not cold, but the particular focus of someone who has run out of patience for the wrong kind of people and knows precisely what comes next. The light in Greer's office went out, not because the power failed, the generators had stabilized an hour ago, but because he turned it off himself, which meant he'd seen something or heard something that made him want to stop being visible. Dana clocked it in her peripheral vision while she was looking at the chart. She didn't react. She kept writing. Vara had positioned himself near the entrance with his agents, and the 3 of them had a brief, low conversation that she wasn't close enough to hear. She didn't need to hear it. She understood the shape of what was happening, the way an investigation moves when it shifts from passive collection to active intervention, the specific gear change that occurs when someone does something stupid enough to accelerate their own exposure. Greer had tried to delete the logs. He'd done it badly, sloppily, the way people do things when they're scared and thinking about themselves instead of the mechanism. 7 minutes too late. The auto backup had run at 12:45, which meant everything he'd tried to erase was sitting intact on a server that he no longer controlled. Dana finished the chart, set it down, picked up the next one. Roy came and stood beside her. He did it quietly, the way he did most things after midnight when the floor had settled into its slower register. "You came back," he said. "Someone has to watch the board." He looked at it. 3 patients in-house, 2 post-stabilization, 1 still being monitored for vitals. The OR board showed 2 active cases. The neurosurgery suite was dark except for 1 room. "Lindqvist's still in with the kid." "I know. Dana." He said her name the way people say names when they want the conversation to be real. "What's actually going on tonight?" She set the chart down and turned to face him. Roy deserved the straight version, or as much of it as she could give without compromising what Vera had told her. Greer just tried to delete the overnight ER logs. The IT system flagged it. Roy stared at her. The backup had already run. The data's intact. He took a breath. Let it out slowly. "Jesus. There's a federal investigation. It's been building. Tonight accelerated things." She looked at him directly. "When they come to talk to staff, and they will, tell them exactly what you saw. All of it. Don't edit. Don't minimize." "What did he try to delete?" "That's what they're going to figure out." She picked the chart back up. "Keep the floor running, Roy. That's what matters right now." He stood there for another second, then nodded and walked back toward the desk. He moved like a man carrying something he hadn't been carrying an hour ago, but he moved steadily, which was what she needed from him. At 1:15, Lindqvist came down from neurosurgery. She still had her surgical cap on, tied loosely, the strings hanging. She walked straight to Dana at the nursing station with the directness of a woman who had made a decision about something and was executing it. "He's stable," she said. "We evacuated the hematoma. No midline shift on post-op imaging. He's in the PICU and responding to stimuli." She stopped in front of the desk. "If you hadn't intubated him when you did, and I mean when you did, not 20 minutes later, not when a physician made the call, the bleed would have herniated before we could operate." Dana nodded. "I'm going to say that in writing," Lindqvist said. "I want you to know that. Whatever is happening with Greer and the administrative situation, I will say in writing that your intervention was clinically correct and almost certainly saved that child's life." "Thank you. Don't thank me. It's factual." Lindqvist glanced toward Greer's darkened office. Something moved across her face. Not surprise, more like the confirmation of something long suspected. "I've been waiting for a reason to say something about this hospital for 2 years," she said. "I think tonight might be it." She pulled off her surgical cap, folded it in half, and walked toward the elevator. She had the deliberate calm of a woman who had made a decision that had been a long time coming and felt neither good nor bad about it, just certain. Dana watched her go. Behind her, from the direction of Greer's office, came the sound of a door opening. He had his coat on. That was the first thing Dana noticed. Greer in his coat, briefcase in hand, moving through the ER toward the main exit with the particular focused pace of someone who has decided that leaving is the best available option. He didn't look toward the nursing station. He kept his eyes on the exit doors. He made it about 20 feet. The female federal agent, Dana had caught her name now, Agent Reyes, DOD Inspector General, stepped away from the wall where she'd been standing for the last hour and moved into his path with the unhurried precision of someone who had done this before. "Director Greer," her voice was conversational. "We'd like a few minutes of your time." He stopped. He looked at her, then at her partner, Agent Drummond, a tall man in his late 40s with the particular patience of someone who had spent a career learning not to rush things. Then he looked at Vara, who was standing near the entrance with his hands clasped in front of him, watching. "I'm off duty," Greer said. "Any conversations can happen through the hospital's legal counsel, during business." "This isn't a conversation about hospital business," Reyes said. "This is a conversation about a server access attempt at 12:52 this morning using your credentials." She said it the same way she might say something entirely unremarkable. "We can do it here or we can do it somewhere more private. Your preference." Greer's jaw tightened. He looked briefly at the nursing station, at Roy, at Carly, at the 2 nurses along the far wall who had gone very still, and his gaze finally landed on Dana. She was looking at him, not with satisfaction, not with anger, just with the direct, level attention she gave everything. "Private," he said. They walked him to the consultation room at the end of the administrative corridor. Vera went with them. The door closed. The ER went quiet for about 4 seconds, and then Roy said, to nobody in particular, "Okay then," and went back to the board, because there was work to do, and that was, ultimately, always the answer. Dana was reviewing post-stabilization vitals on the tanker driver, Dale, who had made it through surgery and was now in the surgical ICU, his numbers holding, when the call came through from the PICU. It wasn't Lindqvist on the line. It was a PICU nurse named Garrett, whom Dana knew slightly, who had the careful voice of someone delivering information that requires precision. "The boy," Garrett said. "Marcus. He's awake." Dana put down the chart. "What's his neurostatus?" Moving all 4 extremities, tracking with his eyes. "He asked for his mom." A pause. "He also asked for the nurse who put the tube in his throat. He said," I'm quoting, "the lady who talked to me before." She closed her eyes for a second. She hadn't talked to Marcus during the intubation. He'd been unconscious, which meant he must have registered something. Her voice, the tone of it, something from the preparation phase, in whatever partial awareness he'd had. "Tell him the tube had to come out," she said. "Tell him his mom is on her way up." "She's already here. She's been here since we brought him up." Another pause. "She keeps asking who to thank." Dana picked the chart back up. "Tell her the whole team did it." She hung up and stood for a moment. The particular relief of this, The specific concrete fact of a 9-year-old asking for his mother moved through her and past her the way these things always did, quickly, because there was always the next thing. But it moved through her. That was the part she never talked about with anyone. Mket. At 1:50 a.m., the consultation room door opened and Greer came out alone. He didn't have his briefcase anymore. He walked back through the ER with the specific mechanical quality of someone who has been significantly reduced, not broken, not yet, but reduced, in the last 45 minutes. He went to his office, and this time the light came back on. Reyes found Dana at the nursing station. "He's being cooperative," she said, and the word cooperative had a specific texture when an investigator said it about someone who'd just tried to destroy evidence. "We need you to give a formal statement. Not tonight. You've been on shift for..." She checked her watch. "Roughly 11 hours. 12 and a half, Dana said. "Tomorrow, if you're willing." "I told Vera I'd call him. I will." She looked at the agent. "What did Greer try to delete?" Reyes was quiet for a moment, the professional quiet of someone calibrating what they can share. "The overnight ER log contains timestamps. Who was assigned to what patient and when? Who gave which orders?" She paused. "There are 2 patients in that log from the last 6 months whose documentation, based on preliminary review, appears to have been altered after the fact. The timestamps would show when the original entries were made and when they were changed." Dana thought of the patient she'd mentioned to Vera. The man transferred out of the ICU too early. The vitals that had been corrected. "How many?" she said. "We're still building the picture." Reyes looked at her directly. "But you're not the only staff member who's noticed something wrong here. You're just the only one who stayed." Dana absorbed this. "The others left?" 3 nurses in the last 18 months, 1 PA. All of them filed complaints that went nowhere and then quietly transferred or resigned. Reyes's voice was even, without editorializing. The Joint Commission reviews were closed on the basis of documentation the hospital itself provided. She let that sit for a moment. Which is why the IT logs matter. If we can show that documentation was altered, you can show the reviews were conducted on falsified evidence, Dana said. Yes. The storm pushed a gust against the windows hard enough to make the glass flex. Dana looked at the board. She looked at Greer's office door. She looked at her hands again. No badge. She'd left it on the desk where he'd made her put it. And then she looked at the desk, where the badge was still sitting. She walked to the desk and picked it up. Roy looked at her. "I know," she said. "He told you to. He put me on administrative leave. He didn't have the authority to confiscate a nursing credential." She clipped the badge back onto her scrubs. "I'm staying until the end of my shift." Roy opened his mouth, closed it, looked at Reyes, who was watching this with the neutral expression of someone who has decided not to have an opinion about it. "Okay," Roy said. Prods. 2 a.m. brought the thing Dana hadn't anticipated. She was in the medication room running through the end-of-shift reconciliation, the careful accounting of controlled substances that was done regardless of what else was happening, because that accounting existed to protect patients, when Carly appeared in the doorway. Carly was 26 and had been out of nursing school for 3 years and was, on most nights, a solid if not spectacular presence on the floor. Tonight had been different for her, and Dana could see it in the way she was standing. Not distressed exactly, but altered, the way a person looks when something has recalibrated their sense of what the job is. "Can I ask you something?" Carly said. "Yes. The intubation tonight, the cardiac code, all of it." She was measuring her words carefully. "I've never seen someone work like that. Not a nurse. Not most doctors either." She paused. "It wasn't... You weren't just executing procedures. You were running the whole room." Dana was writing in the reconciliation log. "Someone has to run the room." "But how did you know?" Carly stopped, started again. "I've been doing this 3 years and I still panic when a patient crashes. Not visibly, but inside. You didn't panic at all tonight." Dana set the pen down. She turned to face the younger woman because this was a real question and it deserved a real answer. "Panic isn't the same as fear," she said. "I was afraid tonight, specifically when I looked at that kid's pupil and thought about what it meant, when Dale's pressure dropped in Bay 3. Those moments are terrifying. She looked at Carly steadily. Panic is when the fear takes over your sequencing. When you stop being able to do the next thing because you're too busy feeling the wrong thing. The way you stop that isn't to stop being afraid. It's to have done the sequence enough times that it runs even when you're scared. Carly was quiet. How many times did you have to do it before it ran automatically? More times than you want to know about. She picked the pen back up. You did well tonight. You steadied. That matters. Carly nodded slowly. She started to leave, then stopped. Those military people, the colonel, they know you from before. Yes. Is that why you came here? To Callaway Ridge? To start over? Dana wrote 2 more lines in the log. I came here because they needed nurses and I needed work, she said. Everything else figured itself out. Carly looked like she understood this was the most she was going to get, which was accurate. She went back to the floor. Dana finished the reconciliation. At 2:30, Greer's office door opened again, and this time he came out with his coat and his briefcase, and Reyes and Drummond on either side of him. Not touching him. They weren't arresting him, not yet. That wasn't how it worked. But positioned in the particular way that made the geometry of the situation clear to anyone watching. He was going with them. He had his phone out, and he was talking into it as he walked, his attorney presumably, or someone he believed could manage this. And his voice was low and controlled and completely at odds with the expression on his face, which had the quality of a man who has understood very recently that the situation he is in is significantly worse than the situation he thought he was in. He passed the nursing station. He looked at Dana. She was writing in a chart. She glanced up. Their eyes met for a moment. She looked back down at the chart. He walked out. The ER doors slid shut behind him, and for the second time that night the room held a specific silence, and for the second time it broke on its own terms. Monitors, movement, Roy exhaling audibly and saying something under his breath that was probably unprofessional and entirely understandable. Vara came and stood near the nursing station. He didn't sit. He looked at the board with the expression of someone who has accomplished part of what he came to do and is already thinking about the next part. The statement tomorrow, he said. I'll send you the location. All right? Dana. He waited until she looked at him. The 3 officers from the JAG case, the Kessler incident, they've been filing motions for the last 4 months claiming the original investigation was politically motivated, that the reports were exaggerated. He held her gaze. Your testimony is the clearest account of what happened that night. There were 6 survivors from that extraction. You're the only one who was positioned to see what the commanding officers did. She was quiet for a moment. The Kessler incident was a thing she had spent 14 months not thinking about directly, keeping it in the peripheral space where things live when you're not ready to look at them straight on. 3 soldiers had died, not from enemy action, from decisions made by officers who had prioritized different things than the lives of the people in their care. She had been the one to make the call to get them out. She had countermanded a direct order to do it. She had gotten 4 people home and buried 3, and the math of that lived in her the way math always did. Not resolved, not finished, just permanently part of the account. I'll testify, she said. Vera nodded once. He looked like he'd known she would, but had needed to hear it. Get some sleep, he said, when the shift's over. He almost smiled. He had the quality of a person who had forgotten how to fully smile sometime in the middle of a career that didn't leave room for it. Right, he straightened. We'll be in touch. He walked toward the exit, paused, turned back once. The work you did tonight. The clinical work. He said it simply, without ceremony. It was exceptional. He left. Dana sat with that for a moment. Then she went back to the chart. By 3 a.m., the storm had begun to ease. Not dramatically. Colorado didn't do dramatic endings to its weather events. It just gradually downgraded them. But the frequency of the gusts lessened, and the sleet had shifted back to rain, and the particular tension that a building holds when the weather outside is dangerous started to release itself from the walls. The ER had 3 patients, all stable. The OR board showed 1 case remaining, a procedure that had started well and was tracking for a normal close. The neurosurgery suite was dark. Dana was doing her final round of the shift when Roy caught up with her. HR called, he said, about the administrative leave. She kept walking. And? The hospital's chief nursing officer wants to speak with you at 7 a.m., before Greer's action is formally processed. He paused. Apparently the CNO was not consulted before Greer issued it. No, Dana said. He wouldn't have been. She sounded... Roy searched for the word. Not pleased. With him. Specifically. He walked beside her. Also, 3 nurses on the overnight shift have apparently called the state nursing board's complaint line in the last 2 hours. About Greer. About the administrative environment generally. Dana stopped walking. She looked at him. Who? Carly was one of them. He said it without quite managing to suppress the expression that went with it. 2 others from the upstairs floors who heard what happened tonight. She looked at the floor for a moment. She thought about the nurses who had filed complaints and transferred out, about the quiet attrition of people who couldn't stay in a place where the wrong things were protected. She thought about Carly, 26 years old, 3 years out of nursing school, making a phone call at 3 in the morning because she'd watched something happen tonight that she couldn't unknow. Tell Carly to document everything she files in writing, Dana said. Date it, keep copies. Don't rely on the hospital's internal system for storage. I'll tell her. He paused. You doing okay? She started walking again. I'll be fine when I know everyone's vitals are stable. Everyone's vitals are stable. Then I'll be fine in... She checked the clock on the wall. About 90 minutes. 3:47 a.m. She was in the break room drinking the worst cup of coffee she'd had in recent memory, which was saying something, given the coffee situation at Callaway Ridge on overnight shifts, when the PICU line rang on her cell. She answered it, assuming it was Garrett again, a follow-up on Marcus's post-op status, something routine. It wasn't Garrett. It was Lindqvist. I need you upstairs, Lindqvist said. Her voice had the clipped precision of a surgeon in motion. Now. Marcus is seizing. Dana was already moving before the sentence finished. She left the coffee on the table and went through the break room door at a pace that wasn't quite running, but was the thing before running, and she was at the elevator in 12 seconds. What's the presentation? She said into the phone. Tonic-clonic started 2 minutes ago, hasn't broken. We've given Ativan... No response yet. The elevator doors opened. She stepped in. Post-op seizing this early suggests re-bleed or cerebral edema. I need a second set of hands and I need them in the next 90 seconds, Dana said. She rode the elevator up. The doors opened on the 4th floor and she moved down the corridor toward the PICU at the pace she'd learned in forward operating bases, which was the pace of someone who knows that 90 seconds is real and not a figure of speech. The PICU was lit and alarmed when she pushed through. The particular environment of a pediatric intensive care unit at crisis. Bright lights and multiple monitors, and 3 nurses already in the bay, and Lindqvist at the bedside with the controlled urgency of a surgeon who has just seen a situation she'd hoped to avoid. Marcus was seizing. His small body was rigid and cycling, his face flushed, his oxygen saturation dropping on the monitor. His mother was in the hallway. Dana registered this, the sound of her, the particular awfulness of a parent on the other side of a glass wall watching a seizure, and she pushed it aside because it couldn't be useful right now. She stepped into the bay. Lindqvist looked at her. Second Ativan dose going in now. If we don't break this in the next 2 minutes, I need to intubate again and get him back to imaging. What's his last post-op scan show? Clean margins on the evacuation. No obvious rebleed on immediate post-op. Lindqvist's hands were at the IV, precise and fast. But seizures this early, it's either edema or there's something we didn't see. Dana looked at the monitor, looked at Marcus. She went to the bedside on the opposite side from Lindqvist and ran her own assessment, airway, the seizure's characteristics, the quality of the movement, the timing, the way his eyes were tracking. How long was he awake before this started? She said. Maybe 40 minutes, the PICU nurse answered. He was talking to his mom, eating ice chips. He said his head hurt, but that's expected post-op. Then he just... Did he vomit? A pause. Once. About 10 minutes before the seizure. Dana looked at Lindqvist. Lindqvist looked at her. A thing passed between them that didn't require language. The recognition of a pattern, a differential diagnosis narrowing in both their minds simultaneously. Hypertension, Dana said. Check his pressure. The PICU nurse read the cuff, called the number. It was significantly elevated. Not catastrophically, but enough. Enough to explain the headache, the vomiting, the seizure in a child whose brain had just been operated on and was responding to the insult of surgery with the particular overreaction of a young, stressed neural system. Posterior reversible encephalopathy syndrome, Lindqvist said. It wasn't a question. That's what I'm thinking. It's rare in this context. It's rare in any context, but the pressure, the post-op timing, the vomiting sequence, the second Ativan dose hit. The seizure broke. Not cleanly, not instantaneously, but it fractured and then it stopped. And Marcus went limp in the particular way that children go limp after a seizure, exhausted and present but not quite returned. The monitor stabilized. Lindqvist gave 2 orders to the nursing staff: antihypertensive medication, specific dose, specific agent, and then she looked at Dana across the bed. If you're right, she said, we need MRI, not CT, different imaging signature. If I'm right, the MRI will show white matter changes in the posterior regions, reversible, with blood pressure management. Dana watched Marcus's face. His color was coming back. His breathing had regularized. He'll need monitoring for the next 48 hours, but the prognosis is actually good. Lindqvist finished it. She looked at the boy for a moment. Then she looked at Dana. You shouldn't be in this unit right now. You're on administrative leave. I'm aware. I'm glad you're here anyway. Dana looked at Marcus, at the rise and fall of his chest, at his small hands limp at his sides, at the monitors recording his return to stability. And she let herself hold this for a moment, the specific weight of it. A 9-year-old who had been in a window seat on the wrong side of a school bus at the wrong moment on the wrong night, and who was going to go home? Who was going to complain about homework and lose his shoes and grow up? That was the thing she never talked about. That was the reason. She stepped back from the bedside. Call me if anything changes. I'll have my phone. She walked out of the bay. In the hallway, Marcus's mother was standing against the wall, and she grabbed Dana's arm. Not aggressive, the opposite, the desperate grip of someone who has run out of other options. Is he okay? Her voice was wrecked. Please, is he okay? Dana looked at her. She had learned over 11 years and 2 careers how to deliver information to people in crisis. The balance between accuracy and what a terrified parent can hold at 3:50 in the morning. He had a seizure, she said. It stopped. Dr. Lindqvist is managing the cause. His numbers are stable right now. She held the woman's gaze. He's fighting hard, and so is his team. The mother held onto her arm for another second. Then she nodded and let go and turned back toward the glass, toward her son. Dana took the stairs back down. She came out on the 2nd floor instead of the 1st because the stairwell landed there, and she was about to take the next flight when she heard it. Voices from the administrative corridor, the one that connected the 2nd floor offices to the document storage room that the hospital used for physical record archives. She stopped. One voice she recognized immediately. Greer. He had come back, or he had never left. She realized she didn't actually know when he'd been walked out. Whether the agents had taken him somewhere or simply escorted him to the parking lot with the time to report in the morning. The other voice she didn't recognize. She moved toward the corner of the corridor without making the decision to do so consciously. It was reflex. The same reflex that had served her in a dozen environments where information was the difference between good outcomes and bad ones. She stopped before the corner and listened. The physical copies, Greer was saying. The digital logs are compromised, but the physical documentation room still has the originals. If we remove the transfer records, the other voice, male, older, she didn't know it, said something she couldn't fully make out. Tonight, Greer said. His voice had the edge of someone who has stopped being careful. It has to be tonight, before they come back with a warrant. Dana stood in the corridor. She had her phone in her hand. She looked at the text thread with Vara. She typed, 2nd floor administrative corridor. Greer is back. Physical records. He's going to destroy them tonight. She hit send. 3 seconds passed. Then the corridor ahead of her, the one leading to the document storage room, lit up as the overhead fluorescence came on, and she heard footsteps, 2 sets, moving quickly. She rounded the corner. Greer was 15 feet ahead of her, a second man beside him, older, in civilian clothes, a hospital administrator she half recognized from board meeting photos posted in the lobby, and both of them stopped when they saw her. Greer looked at her. His face moved through several things quickly. "You're on administrative leave," he said. "You have no business being on this floor." "Neither do you at 4 in the morning," she said. He took a step toward her. The other man hung back slightly, and she registered this. The way he positioned himself fractionally behind Greer, the body language of someone who is present but has decided not to be first. "Walk away," Greer said. His voice had dropped to something that wanted to be threatening and landed somewhere closer to afraid. "Whatever you think you heard, Director Greer." The voice came from behind Dana. She didn't turn. She already knew who it was. Reyes stepped up beside her. She'd come from the stairwell at the other end, which meant Vera had split them, one agent up each staircase, and behind Reyes, Drummond appeared from the same direction Greer had come from, which meant there was no direction that led anywhere useful. Greer looked at Reyes, looked at Drummond, looked at Dana. For a moment, the corridor held its breath. Then Reyes said very calmly, "We're going to need to talk about the document storage room." And Dana watched something happen to Greer's face. The specific collapse of a man who has run every play he has and found each one of them covered. And she thought about the nurses who had left, about the documentation that had been altered, about a patient who had died with falsified vitals in his chart. She took a step back. Reyes moved past her toward Greer with Drummond angling to cut off any exit toward the document room. And the other man, the board member, the accomplice, whoever he was, had gone pale and very still. Dana looked at the document storage room door. It was closed. Locked, presumably. They hadn't reached it yet. She looked at Greer one last time. He wasn't looking at her anymore. He was looking at the agents, and what was on his face now was past threatening and past afraid. It was the expression of someone who understands, with the terrible clarity of a very bad moment, exactly how far they have fallen and how little of it was anyone's fault but their own. From down the hall, faint and real and unchanged by any of this, Dana heard the sound she knew better than almost any other sound. A cardiac monitor, steady and rhythmic, doing its work in the dark. She turned and walked back toward the stairwell. Behind her, she heard Reyes begin the words that investigators begin when something has crossed from investigation into something more concrete. And before the door closed fully behind her, she heard Greer say, in the voice of a man with no more moves, "I want my attorney." She took the stairs down. At the bottom, she pushed through the door into the ER, and the floor opened around her, familiar, lit, functional, and she walked to the nursing station and looked at the board, because there was still an hour left in her shift, and the board was where everything that mattered was recorded, and she was going to stay until it was finished. Roy looked up. He read her face. He looked at the ceiling briefly, which was the closest he got to expressing the full register of what he was feeling. "The document storage room," Dana said. "Get hospital security to stand outside it, now. Don't let anyone in or out without federal authorization." Roy picked up the phone without asking why. She sat down at the station and opened the next chart, and the boy in the PICU kept breathing, and the man in the surgical ICU kept holding his pressure, and the woman in the cath lab kept holding her rhythm, and Dana Wren sat in the hum and light of the only floor she knew how to work and waited for the shift to end and the reckoning to begin. The shift ended at 6 a.m. Dana didn't mark it with anything. She finished the last chart, logged out of the documentation system, stood up from the nursing station. And that was it. The shift was done the way shifts end, not with ceremony, but with the quiet fact of the clock. Roy was still there. He'd been there the entire night, which wasn't unusual for him, but tonight had a different quality. The way a person stays when they feel like leaving would be a kind of abandonment. He handed her a coffee, real coffee, from the machine in the staff lounge that someone had fixed sometime in the last month. And she took it and drank it without comment because it was better than the break room cup she'd left upstairs. "Security's been outside the document room since 4:15, he said. "Agents have the key now. They've been in there since about 5. "Anyone try to access it? Besides them?" "No." He leaned on the counter. "The board member, the guy they brought out with Greer. His name is Warren Pruitt. He's on the hospital's finance committee, has been for 7 years. He said it the way people say things they've spent the last few hours thinking about. 7 years. He used to walk the floor sometimes, shake hands, tell us we were doing great work." Dana drank her coffee. "The CNO meeting is at 7, Roy said. "I know." "You going?" "Yes." He nodded. He had the look of a man who wanted to say something about how she'd been on her feet for 14 hours and should probably sit down somewhere that wasn't a hospital, but he'd known her long enough to understand that this particular suggestion would not be received well, and he let it go. "Carly's still here," he said instead. She waited. Dana looked toward the far end of the floor. Carly was at the medication station doing something that was probably not urgent, the kind of task you manufacture when you want a reason to stay without being obvious about it. She was young, and she was tired, and she had done something tonight that had taken more than she probably expected it to. Dana walked over. Carly looked up. She had the specific kind of exhaustion that happens when your body runs on adrenaline for too long and then the adrenaline stops. The flat eyes, the slightly delayed reactions. "You should go home," Dana said. "I wanted to make sure you were—" Carly stopped. "I wanted to make sure things were okay before I left. Things are moving in the right direction." She looked at the younger woman. "You did well tonight. All of it." Carly nodded. She looked down at the counter, then back up. "The complaint I filed, to the nursing board." She said it like she was still testing whether she'd made the right call. "Was that—" "Yes," Dana said. "It was." Carly let out a breath. It had the quality of something held for a long time. "Go home," Dana said. "Sleep. Come back for your next shift and do exactly what you did tonight." Carly picked up her bag. She paused once at the door, turned back as if she was going to say something, and then didn't, which was sometimes the most honest response available. She left. The CNO's name was Margaret Osei Bonsu, no relation to the surgeon, and she ran the nursing division of Callaway Ridge with the particular authority of a woman who had spent 30 years in clinical nursing before moving into administration and had never let herself forget what the floor actually looked like. She was 61, broad-shouldered, with close-cropped natural hair and reading glasses she wore pushed up on her forehead when she wasn't using them. She had been CNO for 4 years, which meant she had been working under Greer for 4 years, and the expression on her face when Dana walked into her office at 7:02 suggested that this had not been an uncomplicated experience. She looked at Dana across her desk. She looked at the badge, clipped back onto Dana's scrubs. "He told you to leave that on the desk," she said. "He did." "And you went back and got it." "I did." Margaret Osei Bonsu had the expression of someone who has decided to pick her battles, and this is not one of them. "Sit down." Dana sat. The CNO had a file in front of her. Physical paper, actual printed documents, which meant she'd been at this since early enough to pull records before the meeting. She opened it, looked at the first page, looked at Dana. "The administrative leave action Greer filed last night. I've been going through the procedural basis." She turned the page. He cited undocumented scope of practice violations. 3 specific interventions. The intubation, the fast exam, and the medication orders for Ruth Ann's cardiac code. "Yes." She set the page down. "The intubation. Tell me the timeline." Dana told her, precisely in the specific clinical language of someone who had been thinking about how to articulate this since the moment she'd done it. The GCS score at presentation, the rate of decline, the absence of an available physician, the Colorado statute, the documented outcome. The CNO listened without interrupting. When Dana finished, she said, "Lindqvist's written statement arrived in my email at 5:47 this morning." Dana hadn't known about the statement yet. She kept her expression neutral. "She's quite direct," the CNO said. "She uses the phrase unambiguously life-saving in reference to the intubation. She also uses the phrase clinically unjustifiable delay in reference to the conditions that made it necessary for a nurse to make that call." She looked up, meaning the staffing situation, the physician availability, the choices that were made about resource deployment during a mass casualty event. "Greer pulled staff upstairs during the surge," Dana said. "I'm aware." Her voice was flat. "I'm also aware that the overnight staffing model for the ER has been chronically under-resourced for the last 18 months, despite documented requests from the charge nursing team." She tapped the file. "Requests that went to Greer's office and were declined on budget grounds." Dana was quiet for a moment. "How long have you known about the documentation issues?" The CNO held her gaze. A beat. "I knew something was wrong. I didn't know the shape of it." She said it without apology, but without pretending it was comfortable. I filed two internal concerns through the appropriate channels 18 months apart. Both were reviewed and closed. I didn't have the specific evidence to go further. She looked at the file again. The investigators came to see me at 5:30 this morning, before I called you. What did they tell you? Enough. She folded her hands on top of the file. The administrative leave is rescinded. Effective as of when he issued it, it was procedurally improper. He didn't consult me or HR, which is required under the union contract for any disciplinary action involving clinical staff. She paused. I'm also issuing a formal commendation for your work last night to be placed in your personnel file. Dr. Okafor has already sent me a supporting statement, Dr. Osei as well. Dana absorbed this. She wasn't used to this part. The formal recognition, the paperwork of being seen. She'd spent most of her career in contexts where doing the work well was its own accounting, and the documentation came later, if at all. The investigation, Dana said, the federal one. What does the hospital's position look like? Complicated. The CNO didn't soften it. Greer had authority over documentation systems that should have had independent oversight. The Finance Committee had a member, Pruitt, who appears to have had a role in suppressing concerns that reached the board level. She took her glasses off her forehead and set them on the desk. The hospital is going to be scrutinized. Some of that scrutiny will extend to me and to my office, and I am prepared for that. Because if I miss something that should have been caught, I need to know what it was. That was, Dana thought, a rare thing to say. She'd worked for a lot of administrators across 2 careers, and the willingness to say it was rarer than it should have been. What do you need from me? Dana said. Your complete cooperation with the federal investigation. Your continued presence on this floor. She looked at her directly. And I need you to know that I intend to personally review every patient case that the investigators flag for documentation irregularities. Everyone. Whatever we find, we are going to address it, and we are going to report it, and we are going to sit with the consequences of it. She said the last part like a woman who had spent the pre-dawn hours deciding something and was now accountable to the decision. Dana stood. I'll be in at the start of my next scheduled shift. Good. The CNO picked up her glasses. Get some sleep. The sun was up by the time Dana walked out of the hospital's main entrance. It was a weak October sun, the kind that shows up after a major storm looking apologetic, pale and thin over the Rockies to the west. But it was there, and the air outside had the specific clean sharpness that comes after heavy rain when everything that accumulates gets washed away. And for a few hours, the world has better resolution than usual. She stood on the sidewalk for a moment. Her car was in the staff lot. She had Vera's number on her phone and a statement to give in what she estimated was 4 hours if she slept and 5 if she didn't. She had a commendation being placed in her file and an administrative leave that had been retroactively erased. And somewhere on the 4th floor, a 9-year-old boy was sleeping off a seizure that he was going to recover from fully. She walked to her car. She got in. She sat for a moment in the particular stillness of a car interior after a very long night, and she let herself feel, briefly, the weight of the last 14 hours. Not perform it, not process it for anyone, just feel it. The accumulated load of it. The decisions that had been close-run things and the ones that hadn't been close at all, and the ones she was still not entirely sure about. Then she drove home. Vara's call came at 2 in the afternoon. She'd slept for 6 hours, which was more than she'd expected and less than she needed, and she was sitting at her kitchen table with a second cup of coffee and her phone when it rang. The warrant came through at 10 a.m., he said, without preamble. We've been in the document storage room since 10:15. She waited. Donna. His voice had the specific quality of someone delivering information they have been building toward for a long time. We found 9 patient files, physical originals, cases spanning the last 3 years. In every case, the digital record in the hospital's system shows a materially different version of the documentation from what's in the physical original. 9. She'd been thinking 2, maybe 3. What kind of differences? Vital signs, primarily. Transfer timing, discharge assessments. In 4 of the cases, the digital record shows the patient was assessed as stable within a window that the physical original contradicts. He paused. 3 of those 4 patients died within 48 hours of transfer or discharge. She set the coffee down. The other 6 patients survived, Vera continued, but the documentation alterations in their files were consistent with the pattern, covering gaps in care, obscuring timing, making decisions look retrospectively appropriate that were not appropriate when they were made. Greer did this alone? No. He said it flatly. We've identified at least 2 other individuals with system access who made changes to the digital records: a hospital administrator in the Quality Assurance Office, and a physician. Who? A pause. Dr. Bernard Falk. He's the chief medical officer. Dana thought of Falk, a tall, thin man in his 60s who signed off on policy documents and attended the monthly department heads meeting and had, in 2 years of working in this hospital, never once come to the ER during a crisis. He had the quality of a man who managed the medicine without touching it. He was flagging cases for Greer, Vera said, cases where the outcome was poor and the standard of care was questionable. Greer would then facilitate the documentation correction before the quality review process could catch it. Falk signed off on the corrected versions. He exhaled. They were protecting the hospital's liability profile. And their own. She thought of the nurses who had left, the ones who'd noticed something wrong and filed complaints that went nowhere because the evidence they pointed to had been quietly altered. She thought of the Joint Commission reviews that had closed on the basis of documentation the hospital itself had provided. The circularity of it, the system protecting itself by controlling the record of itself. The patient who died 8 months ago, she said, the transfer too early. His file is one of the 9. She was quiet for a moment. Outside her kitchen window, the October light was doing something with the mountains, laying long shadows across the lower slopes. And she looked at it without really seeing it. Greer's attorney has been on the phone with our office since 8 this morning, Vera said. He's going to argue diminished culpability, claim the documentation process was systemic, that Greer inherited a compromised structure rather than created one. He said it without editorial. He may be partly right about the structure, but we have emails. Between Greer and Falk, going back 2.5 years, they knew exactly what they were doing. What's the timeline? Formal charges by end of week, both Greer and Falk. Pruitt is cooperating. He's given us information about board-level suppression in exchange for consideration. He paused. The hospital's board of directors is convening an emergency meeting this afternoon. The CEO may resign before close of business. She picked up the coffee again. It had gone cold. She drank it anyway. Vara, the 3 officers from the JAG case, does this affect the hearing? No, he said firmly. Those are separate tracks. The Kessler testimony happens regardless. A beat. Actually, Dana, the defense team filed a motion yesterday to delay the hearing. They cited a conflict with their lead attorney's schedule. Was it granted? Denied this morning. She could hear something in his voice that was the professional equivalent of satisfaction. The hearing is in 10 days. We need your statement today if possible. She looked at the clock, 2:14 p.m. I'll come in at 4. We'll be ready. He paused. How are you holding up? It was such an unusual question from him that for a moment she didn't have an answer. He was not a man who typically asked it, and the fact that he asked it now meant something about the weight of what they'd both been carrying around this case and this night and the 1.5 years between them. I'm okay, she said. I'll be better when it's done. 4 o'clock, he said. The IG field office was in a low-rise federal building 20 minutes from the hospital, on the other side of Harlan's downtown. The kind of building that existed in every mid-sized American city without distinguishing itself from anything around it. Reyes met her in the lobby and walked her through the security process and up to the 3rd floor, where a conference room had been set up with a recorder and a legal pad and 2 cups of coffee that were significantly better than anything Callaway Ridge could produce. The statement took 2 hours. Reyes asked the questions. Drummond took notes. Dana answered in the same way she'd been trained to answer in every after-action review she'd ever sat through, precisely, chronologically, without interpretation where interpretation wasn't hers to provide. She described what she'd seen in 8 months of work on the ER floor, the patient transfer she'd witnessed, the vital signs she'd personally read, the complaint she'd filed and the response she'd received, the changes she'd noticed in the digital record when she'd looked at it weeks later. She described the previous night in clinical detail, the timeline of events, the moment she'd recognized that Greer was attempting to delete the logs, the conversation she'd overheard in the second-floor corridor. When she finished, Reyes looked at her notes and then looked up. In your original internal complaint, 8 months ago, you cited 2 concerns. One about the patient transfer. The other was, she looked at the paper, staffing levels in the ER during high-volume periods. Yes, that complaint was closed without action. Do you know how it was reviewed? Internally, by the Quality Assurance Office. She looked at Reyes directly, which is the office where one of your subjects works. Reyes wrote something down. She had the quality of a person who was not surprised but was noting the confirmation. The QA administrator reviewed his own department's oversight function. Apparently. And signed off on the closure. Yes, Reyes set the pen down. She looked at Dana with the particular expression of someone who has spent a career in oversight and has arrived, again, at the specific frustration of seeing a system that was supposed to catch these things having been used to conceal them. For what it's worth, she said, the complaint you filed was the thread. When we pulled it, after you became a person of interest to us in the JAG investigation, we pulled everything attached to this hospital. That complaint was the reason we started looking. Dana thought about this. About the night she'd sat in the break room for 20 minutes after her shift and written out the concern report, not knowing whether it would go anywhere, fairly certain it wouldn't, but filing it anyway because not filing it was a choice she couldn't make. Okay, she said. You could have left, Reyes said, like the others. I thought about it. What made you stay? It was a real question. Dana looked at the conference room wall for a moment. At nothing in particular, just the flat institutional surface of it. The patients, she said, they don't get to leave because the administration is compromised. Somebody has to be there. She looked back at Reyes. That's the whole answer. Reyes looked at her for a moment. Then she picked up her pen and wrote something at the bottom of her notes that Dana couldn't see from across the table. She was back in her car at 6:30 when her phone rang. Unknown number, Colorado area code. She almost let it go to voicemail, then answered on the last ring before it would have. Is this Dana Wren? A woman's voice. Older. The kind of voice that had been strong once and still had the architecture of that strength, even though something recent had taken some of the weight off it. Yes, my name is Gloria Marsh. My husband Raymond was a patient at Callaway Ridge 8 months ago. A breath. He passed away 3 days after being transferred out of the ICU. I was told his vitals were stable at transfer. I was told it was... Another breath. I was told it was an unpredictable deterioration. Dana sat in the parking lot with the phone at her ear. The evening light was doing the same thing with the mountains that the afternoon light had done, just in a different direction, darker at the edges. Mrs. Marsh, she said, I've been contacted by the federal investigators this afternoon. They told me... The woman stopped, collected herself with the specific effort of someone who has been grieving and is now being asked to process something that changes the shape of the grief without making it smaller. They told me there may be questions about his care, about the documentation. Yes, Dana said. That's accurate. Were you... She paused. Were you there when he was transferred? I was on the floor that evening, Dana said carefully. I wasn't in the ICU, but I saw him during the transfer. I was in the corridor. Did you... The woman's voice thinned. Did you think something was wrong? Dana looked at the mountains for a moment. This was the part that mattered. Not the federal investigation, not the charges pending, not the commendation in her file, or the administrative leave that had been erased. This was the part that everything else had been built around. This specific woman on the phone, this specific question. Yes, Dana said. I thought something was wrong. I filed a complaint the same night. She paused. I'm sorry I couldn't do more. I'm sorry that what I did wasn't enough at the time. The silence on the other end of the line had texture to it. Will they, the investigators, will they be able to find out what actually happened to him? I believe they will, Dana said. They're good at what they do, and they have the original documentation now, the physical records. She said it as directly as she could. Mrs. Marsh, what happened to your husband is going to be fully examined, and the people responsible for what happened to his record, for what was done to the documentation, are going to face consequences. A long pause. His name was Raymond, the woman said. He was a retired electrician. He liked baseball. He couldn't stand the hospital food, but he ate it anyway because he didn't want to make a fuss. Her voice had steadied itself into something that was past crying and into the harder, quieter territory beyond it. He deserved better than what they gave him. He did, Dana said. The woman thanked her and hung up. Dana sat in the car. She gave herself 4 minutes. She looked at the mountains and she thought about Raymond Marsh, retired electrician, baseball fan, dead 3 days after a transfer that the record said was appropriate and the physical file said was not. She thought about the shape of his family's loss, and the specific addition to that loss of learning that the thing you were told happened was not the thing that happened. Then she started the car and drove. 3 days later, the Harlan Courier ran the story on its front page. By then, it was no longer just the Courier. The Associated Press had picked up the federal charges announcement. 2 Denver television stations had sent crews to the hospital. A healthcare industry publication had already run a detailed piece on the documentation alteration mechanism, how it worked, how long it had gone unchecked, how many institutions used similar oversight structures that could be similarly exploited. Greer and Falk had been formally charged. Greer with evidence tampering, obstruction of a federal investigation, falsification of medical records, and 4 counts of criminal negligence contributing to patient harm. Falk with the same counts minus the obstruction charge, plus a separate count related to his medical license obligations. Warren Pruitt had entered a cooperation agreement and would not be criminally charged, though the hospital's board had already voted to remove him and was conducting its own review of how board-level oversight had failed to catch what multiple staff members had tried to report. The CEO had resigned on the evening of the first day, before charges were formally announced, in a statement that cited a desire to allow leadership transition without distraction, which was the specific language of a person who has received legal advice about what to say and has said it precisely. Dana read the coverage the way she read most things, quickly, noting what was accurate, filing away what wasn't, not lingering. The reporters had found some things right and others slightly wrong in the way that journalism about complex institutional failures often got some things right and others slightly wrong. The broad shape was accurate. The details of her own role were, in some accounts, slightly elevated. One piece called her a whistleblower, which was not inaccurate but also wasn't the full picture, and in others, slightly diminished, reduced to a footnote in a story about federal investigators. She didn't correct any of it. It wasn't her job to manage the narrative. Her job was the floor. She was back on shift by the second day because that was when her schedule resumed and the CNO had made it clear that her position was fully reinstated. The ER received her back the way floors receive people who have been through something significant and returned with the particular attention of a space that knows something has changed but hasn't yet settled on how to talk about it. Roy said when she walked in, "How's it going?" She said, "Fine." He handed her a coffee. She took it. That was that. It was on the 4th day that she got the call from Vera she hadn't anticipated. She was in the middle of a shift, a quiet one, the relative quiet of a hospital trying to find its footing after a public crisis, staff present in full numbers for the first time in recent memory, agency nurses brought in for coverage, a locum physician in the ER while the staffing review ran its process. When her phone buzzed, she stepped into the corridor. "Vara, the defense team in the JAG case," he said. His voice had a quality she hadn't heard from him before, tight, controlled, the sound of someone managing something unexpected. "They've filed a new motion, this morning. The hearing is in 7 days. I know." A pause. "They're citing newly discovered evidence, specifically a communication. An email, they claim, from 14 months ago, between you and a journalist." She went still. "It alleges," Vera continued carefully, "that you shared classified details from the Kessler incident with a member of the press prior to filing your official report. That your account in the official report was shaped to align with what you'd already told the journalist, rather than the other way around." "That's not what happened," she said. "I know that. I spoke to a journalist once. The conversation was about combat rescue protocols generally. It was..." She stopped. Organized. "It was before the Kessler incident, weeks before, and there was nothing classified in the conversation." "I know that," he said again, But the defense team has what appears to be an email that predates your official report by 3 weeks, and they claim it contains operational details that were classified at the time. Then the email is fabricated or it's been misrepresented. Probably, Vera said, but probably isn't enough for a hearing in 7 days. The motion is before the judge now. There's a possibility, not a certainty, but a possibility, that the hearing gets delayed pending verification of the email's authenticity. She leaned against the corridor wall. The fluorescent light above her buzzed faintly. Somewhere down the hall, a monitor ran its steady rhythm. "How long would a delay be?" she said. "Minimum 6 weeks, possibly 3 months." He paused. "Dana, if it delays, the defense team will use the time to build on this angle. They have resources and they have motivation, and they've been looking for something to discredit your account since the investigation began." She thought about what a 3-month delay meant. The 3 officers still on active duty, pending the outcome of the hearing. The 4 people who'd made it home from Kessler, 2 of whom were still in the VA system dealing with injuries that had happened because of the decisions those officers had made. The 3 who hadn't made it home. "Where does the email allegedly come from?" she said. "A server associated with a news organization that folded 2 years ago. The records are fragmentary." He said it with the precision of someone who has already been through this with his legal team, which makes verification difficult in either direction. "Can you get forensic analysis of the metadata?" "We're trying. 7 days is a very tight window for that kind of analysis." She stood in the corridor. She thought about the way the defense team had been operating, the delay motion, the methodical challenge of each piece of documentary evidence, the strategy of erosion, of making the prosecution's case feel uncertain even when it wasn't. They had money and they had time and they had the specific patience of people who understood that in legal proceedings, time itself can be a weapon. "I have something," she said. Vera was quiet. The journalist, her name is Adrienne Moss. She covered military affairs for the Denver Post before the publication reorganized its coverage areas. "The conversation we had was in person, in a coffee shop, and I didn't know at the time that she was recording it for her own notes." She paused. Standard journalism practice. She told me afterward. She asked if I minded, and I said no. She said the next part carefully. "If her original recording still exists, it would establish what we actually discussed and when. It would show what I said and what I didn't say." Vara was quiet for 2 seconds. "You think she kept it?" "I think journalists keep source materials, especially for stories they ended up not publishing." "She didn't publish?" "No, the conversation wasn't about anything publishable. It was background." She pushed off the wall. "I'll call her today." "Donna." He said her name with the weight of someone who has been managing this case for 14 months and is now holding a thread that might change its trajectory. "If she has it, I'll call her today," she said again. She hung up. She stood in the corridor for a moment, then she went back to the floor because the shift wasn't over and the board didn't manage itself, and she could make the call on her next break. She was back at the nursing station, picking up the next chart, when the ER entrance opened and a man walked in who was not a patient and not staff. He was in his 50s, civilian clothes, a press badge on a lanyard around his neck. He had the comfortable confidence of someone who had been doing his job for a long time and knew exactly where he was allowed to stand. He saw Dana at the station and walked toward her. Roy moved to intercept. "Media access requires prior coordination with the hospital's communications. "I know," the man said. He held up his badge. Denver Chronicle. "I'm not here for a story. I'm here to talk to Dana Wren." He looked at her past Roy's shoulder. "Adrienne Moss sent me. She said to tell you she has the recording. She said to tell you it's been in a cloud backup since the day she made it, and she's forwarding it to your attorney and to the IG office within the hour." Dana looked at him. The ER moved around them. Monitors, movement, the ordinary, extraordinary business of a floor full of people working to keep other people alive. "She said one other thing," the man said. "She said she's been sitting on a story about the Kessler incident for 14 months because a source asked her to wait. She said," he glanced at his notepad, making sure he had the quote right. "She said the source told her when it's done, you can say everything. She said she's ready to publish the moment the hearing ends, and she wants to know if the source is ready to go on record. He looked at Dana. Dana set the chart down. She thought about the 3 men who hadn't come home from Kessler. She thought about Raymond Marsh and his hospital food and his baseball games. She thought about Carly at 3 in the morning, making a phone call that took more than she'd expected. She thought about Marcus, 9 years old, asking for the nurse who'd talk to him when he couldn't talk back. She thought about all the ways silence protects the wrong things. Tell her, Dana said, that the source is ready. The reporter wrote it down. And from Greer's empty office, dark now, cleared out, waiting for whoever would come next, there was no sound at all. The recording was 47 minutes long. Adrienne Moss had made it on a Tuesday afternoon in early September, 14 months ago, in a coffee shop 6 blocks from the federal building where Dana had just given her statement. The audio quality was good. Adrienne was professional about her tools, and what it contained was exactly what Dana had said it contained: a conversation about combat rescue protocols, medevac decision-making under fire, the general ethical framework of military medicine in forward operating environments. No names, no locations, no classified operational details. A nurse and a journalist talking about what it meant to make life and death calls in conditions that civilians rarely had to imagine. The recording reached Vara's office at 4:17 p.m. on a Thursday. By Friday morning, the defense team's motion had been denied. Vara called her while she was making breakfast. She had her phone wedged between her ear and her shoulder, scrambling eggs she was going to eat standing at the counter because she hadn't gotten around to caring about sitting down for meals since sometime in her early 30s. The judge reviewed the metadata on the email they submitted, Vara said. The file creation date doesn't match the server timestamp. Someone modified the document after the fact and didn't clean the metadata correctly. He said it with the flatness of someone delivering information that is both professionally satisfying and personally infuriating. The motion is denied, the email is excluded, hearing proceeds as scheduled in 6 days. She put the spatula down. Who made the email? We're looking at that. It may have been someone connected to one of the officers. It may have been an outside contractor. A pause. It doesn't matter for the hearing. It may matter for separate charges down the line. She picked the spatula back up. Okay. You'll need to be in Colorado Springs on the 14th. Testimony is scheduled for 2 p.m., but planned for the full day. He paused. Dana, are you ready for this? She looked at the eggs. They were slightly overdone on one side because she'd been on the phone. Yes, she said. There will be cross-examination. The defense team is aggressive. I've been under fire, she said. Literally. I'll manage cross-examination. A beat. Right. She could hear the closest thing to a smile he ever produced. 6 days. In those 6 days, Callaway Ridge began the process of becoming a different place. It was not a clean process. It was not a fast one. Institutions don't transform because a bad actor is removed from them. They transform, if they do at all, through the slower and less dramatic work of people deciding to do things differently and then doing them day after day in conditions that don't come with guarantees. But some things changed immediately, and the immediacy of them mattered. Margaret Osei Bonsu assumed interim operational authority over the ER staffing model pending a permanent leadership replacement. She did this without fanfare and with the specific decisiveness of someone who had been waiting for the obstacle to move. Within 48 hours, she had reversed 3 of Greer's staffing decisions, restoring the second charge nurse position on overnight shifts that had been eliminated 8 months ago on budget grounds. The Quality Assurance Office was placed under independent external review. The administrator who had processed the falsified documentation, a quiet man named Terrence, who had apparently understood what he was doing and done it anyway, which was the particular horror of complicity, was suspended pending investigation. Dr. Falk's clinical privileges were suspended by the hospital's credentialing committee the morning after he was charged. He had been practicing medicine at Callaway Ridge for 11 years. The suspension was immediate and uncontested because the committee had the votes and the documentation and no appetite for delay. The board elected an emergency chair, a woman from the hospital's community advisory committee, who had no prior administrative authority but had the quality of someone who understood that the moment required steadiness over expertise, and she called a town hall for staff. Dana went. It was in the hospital's largest conference room, the one they used for annual reviews and training sessions, and it was standing room. She stood near the back because she got there late. She'd been finishing a chart. and she listened to the new chair speak with the particular attention she brought to anything that told her what the shape of things was going to be. The chair said 3 specific things that mattered. She said the hospital would fully cooperate with the federal investigation without restriction. She said every patient case flagged by investigators would be reviewed by an independent clinical panel, and families would be personally contacted with findings. And she said that staff members who had previously filed concerns, internally or externally, would be individually contacted by her office to ensure their experience was documented and that the process failures that had made those concerns ineffective were specifically identified and corrected. She said this last thing looking at no one in particular, but several people in the room looked at Dana, and Dana looked at the wall. After the meeting, Carly found her in the corridor. "Did you know that was going to happen?" Carly said. "Which part?" "Any of it." Dana thought about it. "I knew something had to change," she said. "I didn't know if it would." Carly looked at her with the expression of someone turning something over, testing its weight. 3 years, she said. "I've been here 3 years and I thought this was just how hospitals were. I thought the dysfunction was normal. The staffing, the documentation pressure, the way certain things were just never talked about." She looked down the corridor. "I didn't know it could be different." "It's not different yet," Dana said. "It's heading there." "That's not the same thing." "But it's heading there." "Yes." Carly nodded. It was the nod of someone who has revised something fundamental about what they believe is possible, and who is going to carry that revision into a long career and let it change what they're willing to accept. The hearing was on a Tuesday. Colorado Springs in late October had a different quality from Harlan. Higher, drier, the light sharper in a way that had to do with elevation and angle. The federal building where the military hearing was held was nondescript from the outside and institutional on the inside, the kind of space designed to make what happened in it feel procedurally serious, which it was. Vara met her in the lobby. He was in uniform. She was in civilian clothes. She'd worn the best version of what she owned, which was a dark blazer over a gray blouse, because she'd learned a long time ago that how you present yourself in a formal setting is a form of communication, and she intended to communicate clearly. "Ready?" he said. "Stop asking me that." He almost did the smile again. The 3 officers were present when she entered the hearing room. She'd known they would be and had prepared herself for it anyway, because knowing and experiencing are different things. They were in uniform, all 3 of them, the kind of uniforms that get worn when the proceedings are formal, and they sat at their table with the composed stillness of men who had spent months preparing for this and had arrived at the belief that they were going to prevail. One of them, Captain Derek Hale, the one who had given the direct order she had countermanded at Kessler, looked at her when she entered. She met his gaze. She held it for a moment without expression and then turned to find her seat because she was not here for him. She was here for the record. The testimony took 4 hours. The defense cross-examination took another 90 minutes. The attorney was good, methodical, patient, consistently trying to introduce uncertainty about her positioning, her visibility, the exact sequence of communications. She answered each question with the same precision she brought to everything. Where she was certain, she said so. Where she had a limit of visibility, she named it. She did not embellish and she did not soften. And she did not give the attorney a single answer that was more or less than what the question required. At one point, the defense attorney said, with the practiced conversational tone of someone attempting to make a line of questioning feel reasonable, "Sergeant Wren, you've acknowledged that you countermanded a direct order from a superior officer during a combat rescue operation. Is it fair to say that your account of events is partly motivated by a desire to justify that decision?" She looked at him. "No." "You don't feel any need to justify countermanding a direct order?" "The decision to countermand was justified by the outcome," she said. 4 people came home. I don't need to construct a narrative around that. The record is the record. 3 people didn't come home. She held his gaze. 3 people didn't come home because of decisions made before I countermanded anything. That's in the medical records and the after-action reports, all of them. She paused. "I assume you've read them." He moved to another question. When it was over, she sat for a moment in the chair after the room had begun to empty around her. The stenographer was packing up. Vera was speaking with the JAG prosecutor near the door. The 3 officers had filed out with their counsel without looking at her again. She sat in the chair and she thought about Kessler, about the specific geography of it, the way the field station had been positioned, the sound of the extraction, the decisions that had been made in a sequence that led to an outcome she had spent 14 months trying to ensure was accurately recorded. She was not doing this for herself. She had understood from the beginning that it was not for herself. It was for the record, which was the thing that outlasted everyone in the room. Vara came and stood beside her. "You did well," he said. She stood up. "When will the decision come down?" 3 to 6 weeks. He looked at her. "Dana, whatever the decision, you said what happened. That's in the record now. It can't be taken out." She knew that. She had always known that was the only part she could control. You say the true thing, as precisely as you can, and then you let the process do what it does, and you don't attach yourself to the outcome, because the outcome has too many variables. She'd learned this in the military, and she'd relearned it in 2 years of trying to address something wrong at Callaway Ridge. You say the true thing. Then you go back to work. "I'm on shift tomorrow at 7, she said. He walked her out. Ahmed. 3 weeks later, on a Wednesday, the JAG panel issued its findings. Captain Derek Hale was found guilty of dereliction of duty and conduct unbecoming an officer. The specific finding was that he had prioritized operational optics over the safety of personnel under his command during the Kessler extraction, and that his order, the one Dana had countermanded, had been given without adequate consideration of the medical situation on the ground. His co-defendants received findings of failure to supervise and improper reporting. Both findings carried consequences: reduction in grade, formal reprimand, the specific marks on a military record that follow a person through whatever remains of their career. None of them would face courts-martial. The JAG prosecutor had reached for that outcome and hadn't gotten all the way there, which was the frustrating reality of proceedings where evidence, however strong, still had to meet a specific legal threshold. But the findings were public. The record was public. The 3 officers who had walked into that hearing room with the composure of men who expected to prevail walked out of it with their service records permanently annotated with the specific language of what they had done. Dana read the findings summary on her phone during a break, standing in the staff corridor at Callaway Ridge with a cup of coffee. She read it twice. She put her phone back in her pocket. She went back to the floor. Roy was at the station when she came back. He looked at her face and understood something had happened. "Good news or complicated news?" "Both," she said. "You okay?" "Yes." She picked up the next chart. "I'm okay." He watched her for a moment. Then he went back to his own work because that was what you did, and that was the right answer, and both of them knew it. Check. Adrienne Moss's story ran the following Sunday. It was long. It was careful. It was the kind of journalism that took months to report, and it showed in the specificity of the sourcing, in the way it traced the Kessler incident from its origins through the decisions made in the field, through the 14 months of investigation that followed. Dana had agreed to be quoted by name, which she had not done lightly and had spent 2 evenings thinking about before agreeing. The quotes attributed to her were 5 in total. None of them were about herself. 4 of them were about the 3 soldiers who hadn't come home and what their families deserved to know. One of them was about Kessler specifically, about what she'd seen, stated plainly, without the protective ambiguity she'd maintained for 14 months. She didn't read the online comments. She had learned, in her late 30s, that online comments were a category of noise that required no processing. She knew that some people would read the story and understand what it was, and some people would read it and not, and the ratio of those groups was outside her control. What she did read was an email that came through the hospital's general contact form 2 days after the story ran. It had been forwarded to her by the CNO's office because the writer had asked for it to be passed along. The email was from a woman named Patricia, whose daughter had been a patient at Callaway Ridge 2 years ago, before Dana had worked there. The daughter had been treated for a condition that had been mismanaged, and Patricia had filed a complaint that had gone nowhere. She had spent 2 years believing that her complaint had failed because she hadn't been specific enough, hadn't known the right language, hadn't understood how to navigate the system. She wrote, "I read your story, and I want you to know that I don't feel crazy anymore. For 2 years I thought I had done something wrong by pushing back. I thought maybe I had misunderstood what happened to my daughter. Now I know I didn't misunderstand. I just ran into a wall that was designed to make people like me give up. I want you to know that someone who gave up for a while is grateful that you didn't. Dana read this at her kitchen table on a Tuesday morning before a late shift. She read it twice. She sat with it for longer than she'd sat with the JAG findings, or the charges against Greer, or the commendation in her file. She typed back, "Your complaint mattered. It was part of the record that got things looked at more carefully. You didn't give up. You just got stopped by something that shouldn't have been there. Those are different things." She sent it and went to get ready for her shift.
Bob?
In November, the federal charges against Greer and Falk were formally filed in district court. The charges against Mitchell Greer were 7 in total: falsification of medical records, obstruction of a federal investigation, evidence tampering, retaliation against protected whistleblower activity, and 3 counts of criminal negligence contributing to patient harm. The criminal negligence counts corresponded to 3 of the 9 cases recovered from the document storage room. The 3 where the documentation alterations were most directly traceable to decisions made about patient care and where the patients had subsequently died. Raymond Marsh was one of the 3. The charges against Bernard Falk were 5 counts, including falsification of records and 2 counts of criminal negligence. His medical license was suspended by the state licensing board pending trial, which meant he was no longer practicing anywhere. Warren Pruitt, who had cooperated, received a deferred prosecution agreement, a permanent bar from serving on any hospital board or healthcare governance body, and a financial penalty that the court set at a specific number that Dana saw in the news coverage and registered as meaningful without celebrating, because money was not the point. The point was that it was public. The point was that the record now said what had happened, clearly attributable to specific people who had made specific decisions. The point was that Gloria Marsh and Patricia and the families of the 2 other patients who had died knew that what they had suspected was not a misunderstanding, was not a failure of their own comprehension, was not the unpredictable complexity of medicine. It was a choice, made by people with authority, to protect an institution at the expense of the people the institution existed to serve. That was the point. That was the only point worth making. Marcus was discharged from the hospital in early November. He had spent 12 days inpatient. The post-op recovery, the seizure, the careful blood pressure management that had resolved the PRS diagnosis over a week of monitored therapy. By the time he left, he was eating full meals, complaining about the television selection, and demonstrating the specific resilience of a 9-year-old who has been through something serious and is already starting to process it as a story he will tell for the rest of his life. His mother, whose name was Deanna, brought him to the ER on his discharge day. This was not standard. Discharge happened from the floor, not the ER. But Deanna had asked, and the floor nurse had called down, and Dana had said yes because she was on shift, and it was the kind of yes that took no thought. Marcus came through the ER entrance holding his backpack, the one Deanna had brought from home the week before, full of things to keep him occupied. With the slightly tentative posture of a kid who has been in a bed for 12 days and is not yet sure his legs remember what they're for. He was wearing a Denver Broncos hoodie. His left arm had a cast from the forearm fracture, signed by most of the 4th floor nursing staff in several colors of marker. He saw Dana at the nursing station. He walked over. He stood in front of the desk and looked at her with the serious assessment of a child who has decided to pay attention to something. "You're the one who put the tube in my throat," he said. "I am," she said. He considered this. "Did I say anything weird when I was out?" "You were unconscious." "Oh." He seemed faintly disappointed. "My mom said I asked for you." "She told me." He reached into his backpack and pulled something out. It was a stuffed animal, a small brown dog, worn at the seams, one ear slightly flatter than the other from years of handling. He held it out to her. She looked at it, looked at him. "That's yours," she said. "It's a hospital dog," he said, with the logic of a 9-year-old who has worked this out carefully. "It stays in hospitals, to watch over people." He pushed it toward her more firmly. "My grandma gave it to me when I was really little and I was in the hospital. She said it helped. So now it should stay here." Dana looked at him for a moment. At the seriousness of his face, at the cast on his arm, at the Broncos hoodie, at his mother behind him, who was holding it together with the specific effort of a woman who had spent 12 days not sleeping properly and was not going to cry in the ER on the last day because she'd decided she wasn't. She took the dog. She held it for a moment. It was small enough to fit in one hand, and it had that worn, soft quality of things that have been held so many times they've absorbed something of every person who held them. "Thank you," she said. "You saved my brain," he said. "I'm going to be a scientist." "Good choice." He nodded once with the gravity of someone who has made a firm decision and is announcing it as fact. Then he turned and went back to his mother, and Deanna put her arm around his shoulders and steered him toward the exit. And at the door she looked back once at Dana. She didn't say anything. She didn't need to. The door slid shut behind them. Dana set the dog on the shelf behind the nursing station, between the printer and the supply catalog, the most practical and unglamorous location available, and went back to her chart. Roy came and stood beside her 5 minutes later. He looked at the dog on the shelf. He didn't comment on it. He did have the expression of a man who is feeling something he's decided not to put words to, which was often Roy's most honest expression. "Busy night coming," he said. "When isn't it?" she said. December brought the first staffing review results, and then the policy changes, and then the hiring announcements. 3 new ER nurses, a dedicated overnight charge physician position that had been eliminated 4 years ago and was now being restored, a formal mass casualty protocol that incorporated lessons from the October storm and specific procedural language that Dana had been consulted on and had given her input to without being asked twice. She gave her input honestly. Where the draft protocol was right, she said so. Where it had gaps, she named them. Where the language was vague in ways that would create ambiguity during an actual emergency, she rewrote it in the margin in the specific shorthand of someone who had lived through the situation the language was supposed to address. The CNO incorporated all of it. Carly passed her advanced assessment certification in December. She came to Dana's station to tell her, and the way she told it, understated, slightly self-conscious, with the particular pride of someone who has worked hard for something and is still deciding how much to show, was the most honest version of professional achievement Dana had seen in a long time. "You should teach," Dana said. Carly blinked. "I just passed a certification." "I know. You should still think about teaching." She looked at the younger woman. "You explain things clearly. You don't talk down to people. You steady in a crisis." She went back to the chart. "Think about it." Carly walked away with the expression of someone who had just been handed a piece of information they hadn't thought to want and didn't quite know what to do with yet. It was the right expression for that particular information. The trial date for Greer and Falk was set for the following spring. In the meantime, both had entered plea negotiations, which was how these things often moved. The formal charge to the negotiation to the eventual resolution, less dramatic than a trial, but more certain. Dana had been told by Reyes that the plea agreements, if they came through, would include specific sentencing recommendations that the federal prosecutor was committed to. The criminal negligence counts were not going to disappear into probation. The evidence tampering was not going to be reduced to a paperwork violation. She received this information and filed it in the part of her mind that held ongoing processes. Not forgotten, not obsessed over, just tracked. What she couldn't stop thinking about, in the weeks after everything had moved from crisis into consequence, was something smaller than the legal proceedings. It was the staffing meeting she'd attended in her second month at Callaway Ridge 26 months ago, when she'd raised a concern about overnight ER coverage, and Greer had looked at her across the conference table with the specific expression of a man who has categorized someone as irrelevant and is barely listening. She had been an unknown RN at that table. She had been new, without institutional history, without the relationships that give weight to concerns raised in meetings. She had understood clearly that the thing she was pointing at was real, and that the man across from her was not going to act on it. She had not left. She had looked at that expression and decided, not dramatically, not with any particular sense of mission, but practically, the way she'd made every hard decision in 11 years of combat medicine, that the right thing was to stay, to keep doing the work, to keep making the record, to wait for the moment when the record could be used. That was it. That was the whole calculation. Not heroism, not martyrdom, just the specific decision that leaving was a choice that would cost more than it saved, and that someone had to stay, and it might as well be her. She thought about that sometimes when she was doing something completely unglamorous, restocking supply carts, reconciling medication logs, updating care plans that no one would read except the next nurse who needed them. The decisions that matter most often look, from the outside, like nothing. They look like a nurse at a supply cart. They look like a complaint filed on a Tuesday night after a long shift. They look like choosing, without fanfare, to come back the next day to a place you know is broken and do your job anyway until the breaking can be fixed. There is no version of that choice that looks impressive in the moment. That is exactly why it's hard. The hard things never look hard from the outside at the time. They only look hard later, when you can see what they were building toward. In January, she got a call from a nursing program at a state university 2 hours north. They were developing a curriculum module on emergency nursing in mass casualty events. Someone from the state health department, she suspected Reyes had made a recommendation, though she never confirmed this, had suggested her name. They wanted to know if she'd be willing to consult on the material, possibly guest lecture once a semester. She sat with the request for 3 days. She thought about Carly, 26 years old, 3 years out of school, who hadn't known that things could be different. She thought about the nurses who had left Callaway Ridge because the complaint process had failed them and they hadn't had the specific combination of stubbornness and circumstance that had kept Dana in place. She thought about what it would have meant to her, in nursing school, to sit in a room where someone who had done this work talked about it honestly, about what it was, and what it required, and what you did when the institution around you was failing the people it was supposed to serve. She called them back and said yes. The first lecture was in February. 43 nursing students in a room that smelled of whiteboards and institutional coffee. She stood in front of them without notes because she'd learned a long time ago that notes were a way of performing preparation rather than actually being prepared. She told them the truth about emergency medicine, about the gap between the way it was taught and the way it worked, about what it felt like to make a decision without time and without certainty and without the backup that you'd been told would be there. She told them about the October storm and the night it had produced, not as a story about herself, but as a case study in what happens when systems fail and what individuals within those systems are still capable of. She told them about the nurses who had noticed something wrong and tried to address it and been stopped. She told them this was a thing that happened, that would happen to some of them, and that the response to it, what you did when the system pushed back, was the thing that would define what kind of nurses they became. She said, "You will work in places that are broken. Not all the time, not everywhere, but some of the time, in some of the places. The question isn't whether it will happen. The question is what you decide to do inside a broken place. And I want to tell you that doing the right thing quietly, consistently, without recognition, without anyone making it easy, that is not the same as doing nothing. It is, in fact, the whole job." She paused. "Keep the record," she said. "Document everything. File the concern report, even when you're sure it won't go anywhere. Know the statute, know what scope you actually have, and be willing to use it when someone's life requires it. And when someone in authority tells you that you're overstepping, figure out whether they're protecting a patient or protecting themselves. Those are not the same thing, and the difference is everything." The room was quiet. A student in the third row raised her hand. "What if you do all that and nothing changes?" Dana looked at her. She was young, early 20s probably, the specific age of someone who is being asked to go toward the thing that most of the world is designed to move away from. "Sometimes nothing changes right away," Dana said. "That's honest. The record exists anyway. Someone reads it eventually. And you've been the person who told the truth in a room where other people decided not to." She held the student's gaze. "That matters. Even when you can't measure it, it matters." The charges against Greer were resolved in March. He pleaded guilty to falsification of medical records, evidence tampering, and 2 of the 3 criminal negligence counts. The third count, the one most difficult to prove through documentation alone, was dropped as part of the agreement. The sentencing guidelines produced a recommendation of 4 to 6 years. The judge accepted the recommendation and sentenced him to 5, with the first 2 to be served without eligibility for early release. Falk pleaded guilty on the same day to his charges and received 3 years, with surrender of his medical license permanently and without reconsideration. Dana was not in the courtroom. She had been asked if she wanted to attend, and she had said no, because her presence in a courtroom watching someone be sentenced was not a thing she needed. She was on shift. She had a board to manage. Rhea sent her a text that said simply, "Done." She read it at the nursing station between patients. Roy was beside her. He saw her face and read it correctly. Good news? Yes, she said. How good? She thought about Raymond Marsh and his baseball and his hospital food. She thought about Gloria Marsh on the phone, in that specific register of a woman who has learned that the story she was told about her husband's death was not the true story. She thought about the 2 other families, and the 9 cases, and the nurses who had left and the ones who had stayed, and all the things that had accumulated in 3 years of a man in a good suit making decisions in a hospital about what the record should say. Enough, she said. Roy nodded. He understood. The monitor above Bay 2 ran its rhythm, steady, reliable, the particular sound that meant someone's heart was doing its work. And Dana picked up the next chart and looked at the board, because there was always a board and there was always someone on it who needed the next thing. She was at the nursing station writing when the stuffed dog on the shelf behind her caught the light from the overhead panel at an angle that made Roy glance at it. That thing been there since November? He said. Yes. Does it have a name? She looked at it for a moment. The brown dog with the worn seams and the flat ear, given by a grandmother to a sick child, and then given by that child to a hallway shelf in an emergency room. I don't know, she said. Ask Marcus when he comes in for his follow-up. When is that? Next Tuesday. Roy looked at the dog again. It's a little goofy looking, he said. Most things that matter are, she said, and went back to writing. The monitor in Bay 2 kept running its rhythm. The board showed 4 patients. The overnight shift was 2 hours away. Outside, winter was releasing its grip in the slow, incremental way of Colorado. Not dramatically, not all at once, just a few degrees at a time until one morning you walked outside and realized the air had changed. Dana Wren clipped her badge more firmly onto her scrubs, picked up her stethoscope, and walked toward Bay 1. She had a patient. She had work to do. And in a hospital that had been broken and was beginning, carefully and imperfectly, to be rebuilt, that was enough. Not everything. Not the whole accounting, not the cleanest resolution, not the version where no one had died and no records had been changed and no nurses had left because the place had driven them out. Not that version, because that version didn't exist. This version, where you show up, where you stay, where you do the next right thing in the room you're actually in, with the tools you actually have, alongside the people who actually showed up today. Where sometimes a 9-year-old hands you a worn-out dog and tells you it watches over people. Where the badge on your chest is the one you earned, not by rank, not by title, not by the approval of people who needed you to be small, by the work, by showing up anyway, by refusing quietly and completely to be anything other than exactly what you are.